No. Masi seçkin zon naşa haya çiyasin sahut olmaz yone. Kade yasin da çünkü da dünya Allah da nezin doğa Allah'ta naşi gatki hunde. Yahu masi naşe hu. İzun lehu dizan ta sanı kuanı diye çinaslı havadın nasıl ihtiyaç nilezun. Hani kodizan hanezin goki uvi da han sorun haysi sevki da gohin goya çige gotaya ke hunda desin da haya çiya kani di nakya yaht ki sevdi yeta reçi yedanezan çevizita otiye hodeninde gotaya ke hunda kalanizide gayet tininde Nikai one day I can take we get in the take one day. What doesn't that it gone did the you can get on out again only was in it water on it as well and not here then day. Yet how yet done is it out here home then so not she must in it again Mary must show.
Thank you, colleagues. I'd like to thank Elder Jonas Lafferty for the opening prayer and reflections here today. Minister statements. Premier.
Mr. Speaker, the cost of delivering health and social services is increasing faster than our resources can handle, at a time when our government is also facing additional costs related to climate change and inflationary pressures. This is why the delivery of sustainable health and social services is an important part of this government's mandate and the priorities of the 20th Legislative Assembly. Through the mandate letter I provided to the Minister of Health and Social Services, we are addressing several initiatives that aim to deliver a more sustainable health and social services system. These initiatives are complex and multifaceted, and not something the Department of Health and Social Services or the Health and Social Services authorities should undertake alone. Consequently, on July 15th, the Healthcare System Sustainability Unit was created within the Department of Executive and Indigenous Affairs. The focus of this unit is to provide a deeper understanding of which health and social service programs and services should be core to the NWT, analyze how these programs and services can be delivered more efficiently, and determine how these programs and services should be funded within our limited fiscal framework. This work will require coordination with the Department of Health and Social Services, as well as the 3 health authorities. It will also require analysis of a lot of information, including information gained from reviews that have already taken place, and by engaging with those who are contributing most to our system, frontline workers and operational staff. Previous reviews of health and social services system were foundational in guiding operational changes based on our current service delivery, but they did not examine whether these services are fundamental to what our health system should provide. If we expect transformative change to happen, Mr. Speaker, we need to define and prioritize what programs and services are core to the Northwest Territories by using evaluative data, including our current population and demographics, legal and policy frameworks, and technological advancements. We are no longer able to keep expanding our health and social services to meet our growing needs. Instead, we need to transform the way we provide health care and social services in a fiscally sustainable manner. Moving forward with this initiative will better position us to actively respond to these challenges in real time and consider recommendations that can be implemented more quickly than others. We will engage the people who will be affected by change in the work of understanding challenges and identifying solutions, and ensure our work is informed by Northern expertise and lived experience, as well as wise and emerging practices within the sector. This will assure our unique fiscal, political, and legal factors are considered in any changes. This work will be challenging, I'm committed to working closely with the Minister of Health and Social Services and look forward to providing progress reports to members of this House on a regular basis as we engage on this initiative for the benefit of all residents of the Northwest Territories. Thank you, Mr. Speaker.
Thank you, Mr. Premier. Minister statements. Minister for Education, Culture and Employment.
Mr. Speaker, when students have food security, they can focus on learning, growing, and participating within their school communities, and most importantly, on being kids. To help students succeed, the Government of Canada and the Government of the Northwest Territories are working towards signing a 3-year funding agreement that will support the expansion of the NWT school food program, Healthy Food for Learning. Once signed, this new agreement will provide a significant and important boost to the program, creating real results for students and families across the territory. Since 2015, the territorial government has continually invested $650,000 annually into this program. This agreement is part of Canada's broader national school food program, which will invest $1 billion over 5 years across the country, with the goal of providing meals of up to 400,000 children every year. With the high cost of groceries, the new funding agreement will help provide relief to families experiencing pressures of food insecurity and socioeconomic challenges. All 49 NWT schools and all junior kindergarten to grade 12 students will have access to Healthy Food for Learning program as needed, so families can feel confident that their children will receive substantial and nutritious meals and snacks at school. Mr. Speaker, I'd like to conclude my statement today in French. Monsieur le Président, le programme Bien se nourrir pour mieux apprendre a été mis à pied en 2015 dans le cadre de la stratégie anti-pauvreté des territoires de Nord-Ouest, et les écoles du territoire ont joué un rôle crucial à chaque étape de sa création. Des écoles ont notamment
in making on top. The schools have shared wise practices for what successfully food program for them. This has included partnering with the local grocery stores, government departments, and businesses, enabling students to play an active role. For example, in growing the food in school gardens, elders and community members have also been involved in traditional food preparation. Ensuring that all students have consistent access to healthy meals is vital as we work towards improving the students' outcomes and providing all Northerners with the best possible start in life. We want to make sure that all residents will have the best outcome. I am happy to conclude this agreement, and I will explain all of the details with the Canadian government in the next few weeks. Thank you very much, Mr. Speaker.
Thank you, Minister of Education, Culture and Employment. Colleagues, before we go any further, I'd like to recognize some special people here today. Range Lake North School, grade 8 class, welcome to our Legislative Assembly. Greatly appreciate you being here. Well, as their teacher and chaperones, or is just one teacher, or? Oh. 4 teachers. I thought it was 4. So yeah, the 4 teachers. So thank you very much for bringing your students here today, as well as our students from Aurora College. Thank you very much for being here today. Thank you very much. Minister statements. Minister Education, Culture, and Environment, Climate Change.
Mr. Speaker, the Government of the Northwest Territories is committed to maintaining ecosystem health while supporting sustainable economic growth for our communities. A key part of this is the NWT Project Finance for Permanence Agreement, now known as the Our Land for the Future Agreement, which will help to fund Indigenous-led conservation initiatives. The NWT Project Finance for Permanence Agreement provides participating Indigenous governments and Indigenous organizations with the funding to do the things we agreed to do together in our shared conservation work plan, Healthy Land, Healthy People. The GNWT has negotiated a separate agreement with Canada to fund its own needs. Mr. Speaker, since 2018, the GNWT has been seeking long-term funding solutions to support the management of protected areas like Thai-Dene while creating jobs in nearby communities. The NWT Project Finance for Permanence Agreement is an innovative model that brings both funding and partnerships to ensure Indigenous governments and Indigenous organizations lead in the protection of important lands while creating local jobs and economic benefits through initiatives such as Guardian programs, ecotourism, and sustainable development activities. The funding supports progress on shared conservation priorities and will also contribute to Canada's goal of protecting 30% of its lands and waters by 2030. The NWT Project Finance for Permanence Agreement is an Indigenous-led initiative that includes 23 Indigenous governments, the GNWT, the federal government, and 3 private donors. It works within our existing land management process and laws, including the Mackenzie Valley Resource Management Act, and established land use planning processes, ensuring that decisions about the land remain in the hands of the people connected to it. It does not override these frameworks, but provides funding to support Indigenous-led initiatives we agree upon through these decision-making processes. The Healthy Land, Healthy People plan continues to guide our conservation efforts, and the agreement helps provide the resources needed to accomplish these shared goals. Mr. Speaker, in April of this year, the federal government announced $300 million to support the NWT Project Finance for Permanence Agreement, enhanced by an additional $75 million coming from private donors. The agreement includes a strategic plan and financial plan, which outline how the funds will be used to ensure proper oversight and accountability. These plans are designed to ensure that the funding will be directed toward Indigenous-led conservation and stewardship efforts and related economic development activities. The agreement also creates an endowment that will ensure the long-term sustainability of these transformative benefits into the future. Mr. Speaker, the GNWT recognizes the importance of maintaining a balance between conservation and economic development. The NWT Project Finance for Permanence Agreement will contribute to a strong, diversified economy that includes new culturally supportive opportunities in the conservation economy alongside continued investment and development in the resource sector. By ratifying the agreement, the GNWT has taken a significant step to deliver its mandate commitment to promote reconciliation and responsible land management while supporting economic diversification in small communities. This agreement will help to support our shared conservation goals while ensuring that the land and water of the NWT continue to provide diverse opportunities for future generations. Thank you, Mr. Speaker.
Thank you, Minister. Environment and Climate Change. Minister statements, Member statements. Member statements, member from Range Lake.
Mr. Speaker, the digital age dawned so long ago that now our kids are almost born with a smartphone in hand and could not ever contemplate a world without high-speed internet. Indeed, our kids are now teaching us how to use our own laptops and phones. Yet here in the NWT, where the latest generation of healthcare professionals enter the workforce, they are forced into the Wayback Machine to relearn obsolete technology. Why? It's because NTHSSA still sends most diagnostic imaging onto CD-ROMs, while other jurisdictions continue to upgrade dedicated medical communication networks. Using CDs to transmit and store vital data circumvents secure medical communications and therefore poses risks to both patients and medical providers, like leaking confidential information or opening the door to ransomware attacks at a time when healthcare institutions are increasingly targeted. It should come as no surprise, then, that health technicians in other provinces are fed up with the NWT's backward system. Those aren't the only risks outdated systems have to our patients, however. Our cumbersome medical communication often prevents physicians down south from even accessing data at all. A patient sent for a CT scan in Edmonton would need their imaging sent to Calgary to be finalized and then sent back to Yellowknife to be burnt onto a CD for NTHSSA, only to be sent back down to the appointment in Edmonton. On a CD, I might add. That data may not arrive on time or be damaged, resulting in physicians missing vital information and having to order whole new sets of CT scans, which can bombard patients with 500 times more radiation than a simple chest X-ray. That level of unworkable obsolescence is only matched by medical professionals here having to deal with 3 different charting systems, some still only available on paper. Sure, endlessly printing charts and burning CDs might save us from Y2K if it was 1999, but it's 2024 and we need to get with the times if we want more efficient public service. Our doctors and nurses can't keep working in the past. We need to bring them into the future. Thankfully, we don't need Doc Brown's DeLorean. We just need a minister willing to work to bring our healthcare system into the 21st century. Thank you, Mr. Speaker.
Thank you. Member statements. Member from Moultrie.
Thank you, Mr. Speaker. A municipal funding gap. Mr. Speaker, on May 29th of this year, the Standing Committee on Accountability and Oversight tabled a report in this House that noted the municipal funding gap under the current formula would not work without substantial investment. Members discussed a funding formula that equalizes the gap for communities across the Northwest Territories. The government responded on June 13th, noting that MACA recently updated its community government funding policies to, 1, provide a more equitable distribution of funding by basing allocations on a needs-based formula. The new funding policies came into effect in 2024-25. Allocation will not be implemented until 2025-26 to allow time to engage with community governments. Mr. Speaker, I would like to know how the government plans to engage community governments. These changes will not only affect Clecho region, but other small communities as well. The change will have the greatest impact on small communities with population under 500 people. Mr. Speaker, I fear this formula change will negatively affect our Indigenous communities. We have been told that allocations will be implemented over a 3-year transition period. The minister has noted that funding sustainable community government services is a shared responsibility across all levels of government. But, Mr. Speaker, what have the community government told MACA about the implementation of these new formula funding policies? How have the community government been engaged in decision-making? Mr. Speaker, I will have question for MACA at appropriate time. Thank you.
Thank you, member from Moultrie. Member statements. Member from Great Slave.
Mr. Speaker, today I would like to speak to reviewing policing outcomes. As discussed in this House many times, including our last sitting with a motion on supporting mental health response, the NWT relies a great deal on the services of the RCMP. The NWT asks more of them than what is truly their role, Mr. Speaker, and I don't believe it's fair to treat them as social workers. RCMP services are one of the last places we should be asking people to do more with less. I'm glad that there is some change on that front. For instance, through partnerships between NGOs and multiple levels of government, crucial services have begun to be supported, such as street outreach here in Yellowknife. I believe everyone in this House is familiar with the Yellowknife Women's Society's report, Over-Policed and Under-Protected. It examines the relationship between unhoused Indigenous women in the NWT and their interactions with the RCMP. A key recommendation from this report asks the Minister of Justice to support a comprehensive review of policing practices in the NWT by the Federal Civilian Review and Complaints Commission. Notably, such a review must be requested by the Minister of Justice, and it would be at no cost to the GNWT. When some members have put this recommendation forward to the Minister in correspondence, he has responded that such a review would be too narrow in scope and take too long to see results. There has also been interest in investigations on RCMP actions and whether they can be impartial without an independent external agency review. Currently in the NWT, the RCMP investigates the RCMP, albeit from detachments from other jurisdictions, as we have seen in a recent inquest on a death in custody. Cabin Radio recently wrote an article discussing whether it is time to consider an oversight arrangement like that of the Yukon and the Alberta Serious Incident Response Team, a civilian police oversight agency allowed by the Federal RCMP Act. Mr. Speaker, I realize I'm speaking about reviews of both systemic problems and serious incidents, and that these will likely require different approaches and processes, and that is fine. Residents need assurance that if there are negative outcomes in our current policing structures, that an impartial review is possible for both serious incidents and systemic issues. I will have questions for the Minister of Justice at the appropriate time. Thank you.
Thank you, member from Great Slave. Member statements. Member from the Sahtu.
Thank you, Mr. Speaker. Mr. Speaker, I raised the Sahtu issue of recruiting a regional medical travel coordinator during our past spring sitting. Mr. Speaker, the NWT healthcare system is in high demand. It seems, Mr. Speaker, today's society is impacted by many challenges beyond our control. Mr. Speaker, the NWT is resilient in many ways to the challenge it faced and is facing. One could only view the reactive approach to climate change impacts. Mr. Speaker, I had the opportunity during the week of September the 23rd for an invited ministerial tour of the Sahtu region. During this tour, many Sahtu residents raised the need for a medical travel coordinator and improvements to our medical escorts. Mr. Speaker, after some research, the Sahtu region, in particular Norman Wells, there exists 24 funded vacancies. Can we restructure to create 1 or 2 medical travel PYs? Mr. Speaker, I have engaged discussions with many private sector enterprisers. Workforce recruitment is a national concern, particularly in the trades sector. Similar challenges are faced by the government of the Northwest Territories. Later, Mr. Speaker, I'll have questions to the Minister of Health and Social Services. Mussey.
Hear, hear. Thank you, member from the Sahtu. Member statements. Member from the Kenzie Delta.
Thank you, Mr. Speaker. I rise today to speak about a critical issue in our territory, and especially in our small communities. It's housing. We know there is a housing crisis in this territory, shortages of housing, inadequate housing, and great need for public housing. Last week, the Minister of Housing, NWT, stated that the waitlist for the housing across the north is 897 applications. I've asked myself, Mr. Speaker, in this House, how can this be the case if suitability, accessibility, and affordability of housing is a priority of this government? Mr. Speaker, the government of the Northwest Territories isn't doing enough to ensure a path forward for people in need of housing. Indigenous governments are doing what they can, Mr. Speaker, to leverage federal funding and develop housing solutions for their participants and beneficiaries. Just last week, Mr. Speaker, the Standing Committee on Social Development received a public briefing from representatives of the Gwich'in Tribal Council on their new and innovative programming that is putting homes on the grounds in communities and housing families. But they can't do it all, Mr. Speaker. The government of the Northwest Territories must meet its obligations for delivering on public housing programs. Mr. Speaker, I won't speak on the capital estimates investments in housing as it is before committee of the whole. But what I will say is that housing is a human right. This Assembly passed a motion to acknowledge and affirm housing as a fundamental human right. And I will state again that housing is a priority of this Assembly. And I will have questions for the Minister responsible for housing NWT. Thank you, Mr. Speaker.
Thank you. Member from Mackenzie Delta. Member statements. Member from the Deschaux.
Thank you, Mr. Speaker. Mr. Speaker, today I would like to talk about medical travel in the Northwest Territories. As residents, we may all come to rely on the Health and Social Services medical travel program at some point in our lives for health care that isn't available in our home communities. Travel is necessary, Mr. Speaker. This is a reality in our territory with 33 communities spread across the vast land. With little access in and out, limited services are available. A principle of the medical travel policy is that the cost of medical travel should not be an economic barrier to access insured health services. Many patients who require medical travel also require non-medical escorts to accompany them for many reasons. For example, elders who travel south or to a larger center may face language barriers and unfamiliar terrain. This makes it difficult to communicate and navigate in these settings. They need an escort to ensure their appointments go well because of the language barrier. Without this support, the service itself is at risk. The criteria for non-medical escorts says escorts can travel with a patient to provide interpretation if needed. When it comes to the government policy, Mr. Speaker, I hear from residents that they're often not allowed an escort even though one is needed. I often hear that doctors and practitioners approve an escort for medical travel, but then the healthcare center staff arranging turns around and says no, and the request is denied. I would like to know who is making these decisions on behalf of our elders and why they are being denied non-medical escorts. One of the principles of the medical travel program is that it should be transparent and accountable. I will have questions for the Minister of Health and Social Services later. Thank you.
Thank you. Member from the Deschaux. Member statements. Member from Nunavut Lake.
Thank you, Mr. Speaker. Mr. Speaker, the Mackenzie Valley fibre line was completed in 2017. Sorry. The Government of the Northwest Territories, Mr. Speaker, this was welcome news for the residents and the anchor tenants, the Inuvik Satellite Station Facility and the New North Networks and their satellite station facility as well. The Government of the Northwest Territories has made a long-term investment to improve telecommunications service and support and to support economic development along the Mackenzie Valley. Mr. Speaker, with the ability to handle greater volumes of high-speed data traffic with increased reliability, the link provides better access to health, education, and many government services in the Mackenzie Valley communities. For the town of Inuvik, Mr. Speaker, the benefits of being connected to the Mackenzie Valley fibre link are immense. The connection allows Inuvik to strengthen its position as a base for satellite ground stations and Arctic research organizations, and additionally, qualified local contractors have been able to participate in contracts related to the long-term physical maintenance of the fibre optic link. Mr. Speaker, I also understand that the second line, the redundancy line, is now complete. Once the 778-kilometre Dempster fibre line to Dawson becomes operational, it will offer backup. That means if one line goes down, the other can pick up the load. But, Mr. Speaker, businesses and commercial entities in Inuvik are questioning whether or not it's truly redundant, given that our line, Mr. Speaker, runs from Inuvik down to McGill Lake and on through to High Level and into Alberta. The line that's being proposed on the Dempster Highway runs down as far as Fort Nelson. Now, I do understand that there's a potential to have another link go from Fort Nelson over to McGill Lake, but again, that's creating a loop, and to get true redundancy, Mr. Speaker, I think we're going to need that link from Fort Nelson into Alberta as well. So, Mr. Speaker, those are the concerns that have been brought to my attention, and I will have questions for the Minister of Finance later. Thank you.
Thank you. Member from New Boot Lake. Member from Yellowknife North.
Thank you, Mr. Speaker. Mr. Speaker, healthcare sustainability should not be about cuts to services. It is unfortunate that that's the message that the media took away from last Wednesday's public briefing on the new Healthcare Sustainability Unit. From the perspective of those working on the front lines of our healthcare system, we have neither the Cadillac nor the Ford Focus that the Premier was referring to, but rather a vehicle with the wheels coming off that is running on fumes. Yes, the healthcare system has expanded over the years, but let's put this in perspective. This is not just about the addition of non-core services. Some of the positions that have been added that remain unfunded include pediatricians, a 5th emergency room nurse. These are not frills or nice-to-haves. The tool that we need here is not an axe, but it's a screwdriver to tighten things up. And if we're using the vehicle metaphor, we need to first know what our destination is and then take the right amount of fuel for this journey so we don't keep ending up stranded on the side of the road out of gas. Our quest for healthcare sustainability must fundamentally be about delivering the basics right. There is resounding consensus that we need to focus on delivering primary care right. It's about using our resources wisely to offer the best possible care as efficiently as possible. Now, last March, the NWT Medical Association offered valuable recommendations about how we can reduce medical travel and medevacs when someone could receive better care at home. In small communities, community health nurses can be assigned a physician to work with on a regular basis who would act as kind of a consultant. We can embrace the full potential of telehealth. Now, frustratingly, the recent primary care reform ignored what doctors have been calling for many years and missed the opportunity when rearranging the team assignments to assign doctors to small communities. Mr. Speaker, the fuel we need for this journey is our healthcare staff. We need this new unit to center its work around the insights of frontline staff. The Premier referred to how complex this initiative is, but actually we need to focus on a simple goal. We need to figure out how to ensure we have the right amount of staff, the right kinds of staff, doing the right things. Thank you, Mr. Speaker.
Thank you, member from Yellowknife North. Member statements. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, in July 2024, the GNWT released the 2023 Employee Engagement and Satisfaction Report and attached an Employee Satisfaction Action Plan to that report. I do note with some disappointment that favorability scores were noted to decline across all indices relative to the 2021 survey. A couple of items I'd like to highlight, Mr. Speaker. Only 58% of staff felt that innovation was valued in their work. Only 52% said they felt valued as employees or that commitment to quality was a high priority. Overall, morale lowered by 4.9% since the last report was done. I do note that an action plan was published with the report, and I support all those action items. However, I do wonder if a few items were missing. One of them that I'd like to highlight today is the prevalence of overly burdensome bureaucratic processes and how those can, over time, grind people down and reduce morale. I've spoken to staff who have had to go through processes of multiple weeks to get approval to do something like respond to a comment on Facebook. The other thing that I wonder needs more emphasis is the need for empowerment. I would note, Mr. Speaker, that when employees apply to the GNWT, they go through an incredibly burdensome hiring process where they have to do exams, they have to go through sometimes multiple interviews and provide pretty serious qualifications, only to get into a position sometimes where they have very little decision-making power and very little power to act without oversight by management. So I think reduction of micromanagement needs to be looked at as well. Another quote that has stood with me and I wanted to share today is something that someone said to me the other day when I was chatting with them about how things are going at work. If you truly care about your work, your time at GNWT will be limited. That's an unfortunate sentiment for someone to hold in their job. Mr. Speaker, I believe that we have an excellent public service. We have excellent staff at the public service. I request unanimous consent to finish my statement, Mr. Speaker.
Thank you, member from Frame Lake. Member from Frame Lake is asking for unanimous consent to conclude his statement. Seeing no nays, member, you may conclude your statement.
So, Mr. Speaker, I believe that we are going through processes that ensure that we have excellent people in their roles, and then often we're in that role putting them through processes which effectively tell them that their expertise isn't as valued as it could be. So I want us to be looking at that when we're thinking about employee satisfaction, and I want us to be looking at our processes and empowerment of staff. I think it could help us save money over time as we build up our internal capacity for decision making. Maybe we don't need so much management. Thank you, Mr. Speaker.
Thank you, member from Frame Lake. Member statements. Member from Tune-a-Day-Willity.
Mr. Speaker, the clock is ticking to get started on the Premier's 50-year vision for the future of the Northwest Territories, a vision of decentralization of services and empowered Indigenous self-governments. The vision is supported by the action of the previous Assembly, which is committed to implementing the United Nations Declaration on the Rights of Indigenous People, a declaration that internationally mandates the right to self-determination. Furthermore, decentralization of services to Indigenous governments was mandated in the devolution process passed a decade ago. As well, in fact, these rights have been pursued for generations. Yet today, we stand here in this Assembly year after year with no real progress towards goals once more. The cost of inaction is seriously holding our communities back. Indigenous governments alone passes the knowledge, traditions, and perspectives that are needed to solve our health and housing crisis, and they need access to the resources to make it happen. Indigenous governments are allocated $1.6 billion out of the $2.2 billion budget this government gets on an annual basis. Mr. Speaker, but yet, because of the vestiges of the colonial remaining in place, much of those funds don't make it to our small communities, are allocated through restricted policies that don't work for our people. A new deal for the North that respects Indigenous government would therefore give them the resources and empower them are largely entitled so their communities can thrive. This new deal for the North will take a lot of effort and a lot of time, but thankfully a lot of that work has been done already. In 1992, as the Northwest Territory was out the cusp of division, a report was commissioned in the future of the government of the Northwest Territories, written by the late Jim Burke, that outlined the solutions of the North needs for the fair future this Assembly is committed to working towards. The biggest solution offered in Jim Burke's report was the NWT Constitution, which would clearly outline the role and functions of Indigenous governments and have governance in our territory. Unfortunately, despite all the time and money spent on the research a Constitution to produce the report, it was never acted, and instead it was shelved for generation. Well, Mr. Speaker, I can call on to this government to take another look at the Jim Burke report. We need to work as soon as possible as the claim is being settled. Mr. Speaker, I seek unanimous consent to conclude my member statement. Thank you.
Thank you. Member from Tune-a-Day-Willity is seeking unanimous consent to conclude his member statement. Any nays? No nays. You may conclude your statement.
Thank you, Mr. Speaker. Thank you, colleagues. To do so, we must work together to figure out a process to achieve these goals through a council of leaders and stride working group and committee to make this progress that has been promised for decades. As Canada makes its way for a long journey towards justice and reconciliation for Indigenous people, the North can use this critical junction we are striving for as an opportunity to develop a model of governance. Mr. Speaker, I would have questions for the Premier at the appropriate time. Thank you.
Thank you, member from Tune-a-Day-Willity. Member statements. Member from Yonge Centre.
Thank you, Mr. Speaker. In economics, there's a phrase called Joven's paradox, which occurs when technology progresses in a manner to increase efficiency, but the resource is actually inversely further demanded because we've lowered the cost. So in other words, Mr. Speaker, historically governments have been trying to find ways to be more efficient, but in turn, efficiency gains enthusiasm, which increases consumption. This is called the rebound effect of Joven's paradox. So a good example is when you make fuel efficiency vehicles, Mr. Speaker, people tend to drive more and hence consume more fuels. Mr. Speaker, in the end, it results that just because you make something cheaper and solve a problem, you don't necessarily take into the greater consideration of the demand it's now created. Now, the EU has noted, Mr. Speaker, and this is where it's important, that this principle of efficiency on economics also applies to government policy, and it can apply to us. So how does it apply to the GNWT? Well, take the encampment, for example, Mr. Speaker. Are we addressing the cause or are we addressing the symptom of some of these problems? By fixing it with a Band-Aid solution, Mr. Speaker, or is the government temporarily making things worse? Are we empowering people? That is really addressing the cause. Are we finding ways to create sustainable communities and independent people? I'm not so sure. Mr. Speaker, I agree something needs to be done, hands down. I would definitely stress that, solutions like Aspen Apartments, fixing it up is not a terrible solution in any way. But for 38 units, 38 potential families waiting for a solution for between 1 and 2 years away from now has done nothing to solve the problem. Mr. Speaker, sometimes I say a 4-door Corolla could solve our problems. Why are we buying Escalades? We don't need them, Mr. Speaker. There's nothing wrong with Aspen Apartments that couldn't house people today. In other words, we could be saving and changing the lives of 38 people, 38 families. By sowing these seeds, possibly we'd be getting the right effect. Mr. Speaker, we also have other temporary solutions when we're scrambling for them. The government has the Territorial Treatment Centre, the TTC, right across the street from the encampment. We could be partnering with the Women's Society, we could be partnering with the YWCA or even the Salvation Army to temporarily solve the solution. Let's not bring a hammer when we don't need one, Mr. Speaker. We could work with our communities in partnership with our social agencies, and I'll have questions for the ministers during question period later today. Thank you, Mr. Speaker.
Thank you, Member from Yonge Centre. Member statements. Colleagues, it's been over a year since Adam Yendo passed away on the fire line while protecting his home community of Fort Liard. Family members, residents, and fire crew held a small private ceremony in Fort Liard in remembrance of Adam. Colleagues, he leaves behind a partner, a young daughter, dad, brother, and sister, and many cousins and nieces and nephews. I can tell you it weighs on us a lot of his passing, and it's my understanding that firefighters across the territories doing the same difficult work Adam did are thinking of him and how he lost his life. When you hear the message that the fire crew heard each day, the safety of your team must always be first priority. It brings it home about critical importance of safety in the field. The family, his friends, the community would like to thank NWT Fire for creating the scholarship in Adam's memory for people in post-secondary education and force-related field. This past fall, Adam was remembered by the Canadian Fallen Firefighters Foundation at the Canadian Firefighters Memorial in Ottawa. The family would like to thank the department for all its support to get there and be part of this event, as well for having the minister attend. In closing, I'd like to use Adam's partners, Keena McLeod's word. He was such an outgoing person. Everyone liked being around him, and he was loved by all his friends and family. He liked being outdoors, being on the land, discovering new places, and experiencing new things, and more importantly, meeting new friends. In closing, I'd wish to use the quote I heard from NWT Fire. Though nothing will repair the hole his absence leaves in the lives of those who knew and loved him, our steadfast support remains with his family and friends as they navigate the difficult path forward. Member statements. Member statements. Oh, sorry. Recognition of visitors in the gallery. Member from Mophie.
Merci, Mr. Speaker. Mr. Speaker, don't let's inawu tsunkera. Merci, the Klitschonetzel, Akagwige, Elita Woodson, Terry Lafferty.
Anita Woodson, Diane Lafferty, did use and Linda Mathias Ollier. They live here in Yellowknife, going to school. They're working to further to education. I know that their parents and their family members, and also a lot of these young kids, I don't know who they are from the school. I am happy that they are here, I do believe. And also they are here with their teachers as well, the ones that are in here. Masi Cho.
Recognition of Visitors Gallery. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, I'd like to recognize Ms. Tarleton's grade 8 class from Range Lake North, which is a school in my riding. Great to see you here today, and it was lovely to speak with you before the session. Go Hoyas.
Thank you, member from Range Lake. Recognition of Visitors and Gallery. Member from Toonaday-Willowday.
Thank you, Mr. Speaker. Mr. Speaker, I'd like to recognize a constituent of mine, Verna Abel Catholic. I just want to say welcome to the Assembly. Also to all the students from the college and the students from Range Lake as well. Thank you.
Thank you, member from Toonaday-Willowday. Recognition of Visitors Gallery. Member from Mackenzie Delta.
Thank you, Mr. Speaker. Today I would like to recognize my CA, Georgina Nyanda, who has traveled down with me from Fort McPherson to be here to take in do some work here in the Assembly on my behalf. Just like to welcome Georgina. Thank you, Mr. Speaker.
Recognition of Visitors and Gallery. Member from Elney Centre.
Thank you, Mr. Speaker. Mr. Speaker, I'd like to recognize the students of Aurora College. That's an excellent campus downtown in the Yellowknife Centre riding. It's not exclusive in Yellowknife. Yes, we have a campus college in Fort Smith and Inuvik, but today we have the Yellowknife students. Also, Mr. Speaker, I'd also like to recognize a constituent, Karina, it looks like Pukas. I haven't met her, but that said, I'd like to, or Puskas, sorry, my apologies. Karina Puskas, and thank you for joining the Assembly and seeing our proceedings before the House. Thank you very much.
Recognition of Visitors in the Gallery. Member from Nuvik Twin Lake.
Thank you, Mr. Speaker. Mr. Speaker, I'd like to welcome Amy Lee, a longtime colleague of mine way back when. Thank you, Mr. Speaker.
Member from Nuvik Twin Lakes. Recognition of Visitors in the Gallery. Recognition of Visitors in the Gallery. If we've missed anyone in the gallery today, welcome to your chambers. I hope you are enjoying the proceedings. It's always nice to have people, or see people in our gallery. Recognition of Visitors in Gallery. Recognition of Visitors in Gallery. Reports on Committee on the Review Bills. Reports of Committees on the Review Bills. Reports of Standing and Special Committees. Member for Mophie.
Mr. Speaker, your Standing Committee on Social Development is pleased to provide its report on the statutory review of the Mental Health Act and commends it to the House. And Mr. Speaker, I move, seconded by the member for Mackenzie Delta, that the committee report 16-20, bracket 1, Standing Committee on Social Development report on the statutory review of the Mental Health Act be deemed read and printed in Hansard as its entirety. Thank you, Mr. Speaker.
Thank you. Thank you. Thank you, member. The motion is in order. To the motion. Question has been called. All those in favor? Aye. All opposed? Abstentions? Motion passed. Member from Mophie.
Thank you, Mr. Speaker. Mr. Speaker, I move, seconded by the member for Mackenzie Delta, that committee report 16-20, bracket 1, be received and adopted by the Legislative Assembly. Thank you, Mr. Speaker.
Thank you, Member from Mophie. Motion's in order. To the motion. Question has been called. All those in favor? Opposed? Abstentions? Motion's passed. Member from Mophie.
Mr. Speaker, I move, seconded by the member for Mackenzie Delta, that pursuant to Rule 9.4, bracket 5A, the Government of the Northwest Territories table a comprehensive response to Committee Report 16-20, bracket 1, including all recommendations within 120 days, or at the earliest opportunity subsequent to the passage of 120 days. Thank you.
Member from Mophie. Motion's in order. To the motion. Question has been called. All those in favor? Opposed? Abstentions? The motion is carried, and Committee's Report 16-20, brackets 1 has been received and adopted by the Assembly. Reports on standing committee or standing and special committees. Member from Great Slave.
Mr. Speaker, your Standing Committee on Procedure and Privileges is pleased to provide its report on the review of the rules of the Northwest Territories Legislative Assembly. Mr. Speaker, I move, seconded by the Honourable Member for Hay River South, that pursuant to Rule 6.1, brackets 2, brackets N, Committee Report 1720, brackets 1, Standing Committee on Procedure and Privileges report on the review of the rules of the Northwest Territories Legislative Assembly be deemed read and printed in Hansard in its entirety. Thank you, Mr. Speaker.
Thank you. Member from Great Slave. Motion's in order. To the motion. Question hasn't been called. All those in favor? Opposed? Abstentions? Motion passed. Member from Great Slave.
Mr. Speaker, I move, seconded by the Honourable Member for Hay River South, that Committee Report 17-20, brackets 1, Standing Committee on Procedure and Privileges report on the review of the rules of the Northwest Territories Legislative Assembly be received by the Assembly and referred to Committee of the Whole. Thank you, Mr. Speaker.
Thank you, Member from Great Slave. Motion's in order. To the motion. Question has been called. All those in favor? Opposed? Abstentions? The motion is carried. Committee Report 17-20, brackets 1 has been received and adopted by this Assembly. Reports of standing and special committees. Member from Great Slave.
Mr. Speaker, your Standing Committee on Procedure and Privileges is pleased to provide its interim report on the report of the Chief Electoral Officer on the administration of the 2023 territorial general election. Introduction. Pursuant to subsection 266, brackets 2 of the Elections and Plebiscites Act, the Chief Electoral Officer must report on the administration and event initiatives seen through that office within 6 months following a territorial general election. The report has any matters the CEO thinks should be brought to the Legislative Assembly's attention. It also includes recommendations on how to improve election administration alongside any suggested amendments to the Act. The Speaker tabled the CEO's report on May 21st, 2024 in the Legislative Assembly and was subsequently referred to the Standing Committee on Procedure and Privileges for review and response. Committee sought public feedback on the CEO report from September 2nd to September 27th, 2024, receiving 2 written responses. On September 27th, 2024, Committee held a public briefing with CEO Stephen Dunbar and Deputy CEO Charlotte Dignas. Mr. Alexei Tovanin of Vote 16 Canada also provided testimony at the public hearing, speaking specifically to the recommendation from the CEO to lower the Northwest Territories voting age to 16. Background. Due to the wildfire evacuation of almost 70% of the Northwest Territories population, which represented 14 of 19 electoral districts, the Legislative Assembly passed an act to postpone polling day for the 2023 general election on August 28, 2023. This act moved the previously established September 3, 2023 expiration date of the 19th Assembly to November 14, 2023. The Commissioner of the Northwest Territories ordered the CEO to issue the writs of the election on October 16th within the prescribed 29-day campaign period. On Election Day, 34 polling locations opened across the territory for the 16 electoral districts. In total, 10,797 votes were cast, representing 52.54% voter turnout. Committee wishes to thank the CEO and staff of Elections NWT for both the management of the 2023 territorial general election and their work on their report. The challenges faced by Election NWT following the evacuation was unprecedented. However, the election process occurred as seamlessly as possible due to their hard work and dedication to their roles. Repeal and replace the Elections and Plebiscites Act. The current Elections and Plebiscites Act was developed following the 2003 territorial election and first used in the 2007 territorial election. It has been substantially amended 5 times since, in 2010, 2014, twice, 2018, and most recently in 2022. The Election and Plebiscites Act has not been holistically reviewed since 2007. Given that previous amendments to this act are often made to address specific issues, the CEO, throughout their report, has noted many inconsistencies, contradictions, or limitations to appropriately and flexibly support the elections processes in the Northwest Territories. Although the mass evacuation of the Northwest Territories highlighted some of obvious vulnerabilities within the current Elections and Plebiscites Act, including a lack of direction and guidance for emergency management situations, this is supplemented by other challenges faced by a lack of modernized legislation. Clarity is required as modern society grapples with more varied uses of social media. This is impactful not only for advertising guidelines or the use of third-party advertisers, but also for the growing use of artificial intelligence. A more modern regulatory framework that better reflects the operating reality of our everyday communications should be better reflected in the Elections and Plebiscites Act. The CEO's report also outlines the need for more concrete guidelines for mobile polling stations, absentee ballots, and special voting opportunities. The need to ensure that more people have access to and options for their ability to vote is a concern that both CEO and the committee members agree with. Beyond that, updated guidelines for provision of food during candidate events or the removal of the elimination nomination deposit can be changed to better reflect national best practices in those areas. The list of suggested amendments is extensive. However, it reflects the nature of how this important piece of legislation is ultimately updated and requires that at a certain point, more complete update must occur. Addressing specific amendments does not necessarily ensure that more comprehensive legislative or policy goals can be addressed, which has led to a lengthy list of cleanup, modernization, and consistency concerns required to be addressed throughout the current Act. Recommendation 1. The Standing Committee on Procedure and Privileges recommends that the Legislative Assembly direct the Chief Electoral Officer to undertake a repeal and replace of the Elections and Plebiscites Act before the end of the 20th Assembly. Expand Elections NWT mandate. The CEO's report highlights Elections NWT's capacity and willingness to do more to support all election activity within the Northwest Territories. Expanding the mandate of Elections NWT to include local authorities would allow for greater collaboration and support for logistics, voter list management, a more comprehensive register, improved information sharing, and to refine the capacity to deliver on election activities. Allowing Elections NWT to support local authorities has the potential to better streamline and capture important information that then feeds into more complete data sets of all communities, regardless of the type of election occurring. It also creates opportunities to reduce duplication of materials and build broader capacity throughout the Northwest Territories for election activities. The CEO's report highlights that they can and wish to play a larger role in all elections, similar to how other election bodies run throughout Canada. Recommendation 2. The Standing Committee on Procedure and Privileges recommends that the Legislative Assembly direct the Chief Electoral Officer to engage with the Northwest Territories Association of Communities to determine how to better support local authority election activities. Reduce the voting age to 16. Voter turnout in the Northwest Territories remains very low, and as noted in the CEO report, particularly low for voters under the age of 30. Committee wishes to continue their investigation into the request of the CEO to lower the voting age to 16 and will provide a separate report in the 2025 winter sitting of the Legislative Assembly on their findings and the response to this recommendation. Conclusion. Committee again wishes to thank Elections NWT for their hard work, dedication, and support to not only candidates of the election, but also residents of the Northwest Territories. Mr. Speaker, I move, seconded by the Honourable Member for Hay River South, that Committee Report 18-20, Brackets 1, Standing Committee on Procedure and Privileges Interim Report on the report of the Chief Electoral Officer on the administration of the 2023 Territorial General Election be received by the Assembly and referred to Committee of the Whole. Thank you, Mr. Speaker.
Thank you, member from Great Slave. Motion's in order. To the motion. Member. To the motion. Question has been called. All those in favor? Aye. Opposed? Abstentions? The motion has passed, has been received, and the report has been received and referred to Committee of the Whole. Reports on standing committee and standing and special committees. Member from Great Slave. Or no, sorry, Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, your Standing Committee on Government Operations is pleased to provide its report on the statutory review of the Cannabis Legalization and Regulation Implementation Act. Mr. Speaker, I move, seconded by the member for Great Slave, that Committee Report 19-20 Sub 1, Standing Committee on Government Operations report on the statutory review of the Cannabis Legalization and Regulation Implementation Act be deemed read and printed in Hansard in its entirety. Thank you, Mr. Speaker.
Motion's in order. To the motion. Question has been called. All those in favor? Aye. Opposed? Abstentions? Motion has passed. Member from Great Slave, or Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, I move, seconded by the member for Great Slave, that Committee Report 19-20 Brackets 1, Standing Committee on Government Operations report on the statutory review of the Cannabis Legalization and Regulation Implementation Act be received and adopted by the Assembly. Thank you, Mr. Speaker.
Thank you. Member from motion's in order. To the motion. Question has been called. All those in favor? Aye. Opposed? Abstentions? Motion carried. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, I move, seconded by the member for Great Slave, that pursuant to Rule 9.4, Brackets 5A, the Government of the Northwest Territories table a comprehensive response to Committee Report 19-20 Brackets 1, Standing Committee on Government Operations report on the statutory review of the Cannabis Legalization and Regulation Implementation Act, including all recommendations within 120 days or at the earliest opportunity subsequent to the passage of 120 days. Thank you, Mr. Speaker.
Thank you, member from Frame Lake. Motion's in order. To the motion. Question has been called. All those in favor? Aye. Opposed? Abstentions? Motion is carried. Committee report 19-20 Brackets 1 has been received and adopted by the Assembly. Reports of standing and special committees. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, your Standing Committee on Government Operations is pleased to provide its report on committee's initiation of the 10-year review of the Northwest Territories Heritage Fund Act. Mr. Speaker, I move, seconded by the member for Great Slave, that Committee Report 20-20 Brackets 1, Standing Committee on Government Operations report on committee's initiation of the 10-year review of the Northwest Territories Heritage Fund Act be deemed read and printed in Hansard in its entirety. Thank you, Mr. Speaker.
you. Member from Frame Lake. Motion's in order. To the motion. Question has been called. All those in favor? Opposed? Abstained? Or abstentions? Motion's passed. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, I move, seconded by the member for Great Slave, that Committee Report 20-20(1), Standing Committee on Government Operations Report on Committee's initiation of the 10-year review of the Heritage Fund Act be received and adopted by the Assembly. Thank you, Mr. Speaker.
Thank you, member for Frame Lake. Motion's in order. To the motion. Question has been called. All those in favor? Opposed? Abstentions? Motion is carried. The committee report 20-20(1) has been received and adopted by the Assembly. Reports of standing and special committees, reports of standing special committees, returns to oral questions, acknowledgements. Before we go into oral questions, folks, I've had a number of people bring forth their concerns about lengthy conversations between members during statements and oral questions, and it's becoming a distraction. So even when people put their hearing or their earpieces in, they keep on hearing. There's been distraction. So if you have the required to talk to your colleagues, please do it outside the chamber so we can move forward, so everybody can do the business. Thank you. Oral questions. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, my questions today are for the member of... Minister. Sorry. Off to a great start here, Mr. Speaker. Mr. Speaker, my questions are for the Minister of ECC. Mr. Speaker, I spoke in previous sessions about targeted amendments to the waters regs, and I'm just looking for the department presented to Standing Committee recently, and I am looking for an update from the Minister on their progress towards making targeted amendments to the waters regs. Thank you, Mr. Speaker.
Thank you, member from Frame Lake. Minister of Environment and Climate Change.
Thank you, Mr. Speaker, and thank you to the member for the question. The proposed approach for the waters regulation, the department has been looking at the recommendations from the Chamber of Mines, the Land and Water Boards of the Mackenzie Valley, as well as some requests from Indigenous governments and how we can work together through our process with the Intergovernmental Council and through the Legislative Development Protocol to advance the amendments to the regulations, as well as some targeted amendments that have been identified by the Department of Environment and Climate Change. Thank you, Mr. Speaker.
Minister of Environment and Climate Change. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, is the minister able to give us any kind of a timeline? I think the idea with the recommendation from all these different entities for targeted amendments is that we get them done quickly, that this could be a quick win for the department and a quick win for regulatory fairness and certainty in the territory. So can the minister give us a timeline for when they expect the targeted amendments to be concluded? Thank you.
Thank you, member from Frame Lake. Minister of Environment and Climate Change.
Thank you, Mr. Speaker. Mr. Speaker, the process to address the targeted amendments will require the participation of the Intergovernmental Council as well as the Intergovernmental Council Legislative Development Protocol. And so the Department of Environment and Climate Change is not able to set that timeline, but we certainly do recognize the urgency of attempting to move this as quickly as possible, and we will continue to work with all parties to advance that. Thank you, Mr. Speaker.
Thank you, Minister of Environment and Climate Change. Oral questions, member from Frame Lake.
Thank you, Mr. Speaker. It might have been ambitious to ask for a conclusion timeline. Maybe I could get a timeline on when this process is going to be established. So it sounds like the department's been looking at it, but hasn't actually established a process. Mr. Speaker, I've been asking about this since our first sitting. So has the department actually initiated these conversations, knowing that it might take some time? It's time to get the discussions going. Thank you, Mr. Speaker.
Thank you, member from Frame Lake. Minister of Environment and Climate Change.
Thank you, Mr. Speaker. Mr. Speaker, yes, the department is in the very early stages of discussions with the ICGS, and we are hoping to advance that in a timely fashion. Thank you, Mr. Speaker.
Minister of Environment and Climate Change. Final supplementary. Oral questions. Member from Inuvik-Boot Lake.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Finance. Given my statement today on the redundancy of the fiber optic line traveling up the Mackenzie Valley, I'm wondering if if the Minister could give me an update on where they are with the true redundancy plan for this line. Thank you.
From Inuvik-Boot Lake. Minister of Finance.
Thank you, Mr. Speaker. Mr. Speaker, the Government of Northwest Territories is a part owner on a P3, which is the Mackenzie Valley fiber line that goes up the Mackenzie Valley. And recently, we are now connected into a project that goes through the Yukon, which is creating a loop that goes down into British Columbia. So we are well underway to having a loop that connects all throughout the two territories. And of course, then beyond that, there are services that go down in to Alberta through our line or through British Columbia through the other lines. So once that is all in place, Mr. Speaker, we would have, again, a loop that connects all or both of the two territories. Thank you, Mr. Speaker.
Minister of Finance. Member from Inuvik-Boot Lake.
Thank you, Mr. Speaker. Thank the Minister, and I certainly applaud the efforts to get from the Yukon government and both ourselves to get that redundant line in. My concern, Mr. Speaker, is the beyond Fort Nelson. So the redundancy line right now goes into Fort Nelson. Is the Minister aware of any negotiations either taking place or plan to take place to ensure that we have access to that line as well? So if the Minister to that line as well. Thank you.
Member from Inuvik-Boot Lake. Minister of Finance.
Thank you, Mr. Speaker. Mr. Speaker, we do have what's called an indefeasible right of use, or the ability to use the line that goes from McGill Lake down into British Columbia. That's that last piece that connects our loop. It ensures that we have the ability to use that infrastructure, which would otherwise be entirely that of Northwest Tel, just as there's agreements with us and the government of the Yukon to use either side of this network or the loop, as I was describing earlier. Mr. Speaker, with respect to what happens after McGill Lake, that piece does belong to Northwest Tel, just as we would be looking at other carriers when ours goes down from our side of the loop down into Alberta. So I'd certainly have to go back and confirm the degree to which we're having those discussions and ensure that we maintain an ability to use those lines, or that our carriers have the ability to use those lines. Thank you.
Minister of Finance. Oral questions. Member from Inuvik-Boot Lake.
Thank you, Mr. Speaker. Yes, I understand there is the IRU for the line beyond high level. But I guess my question is, if there's a disruption beyond high level, then we won't have the access to go the full loop from Alberta up to Fort Nelson. So is there any conversations taking place to have an IRU, as the Minister mentioned, on that line as well, the Fort Nelson to Alberta line?
Minister of Finance.
Thank you, Mr. Speaker. Mr. Speaker, I believe there are still conversations underway right now with the Department of Finance on behalf of the Government of Northwest Territories and Northwest Tel. We were also involved just this past summer and into the fall in terms of producing, or rather providing, completion of a fiber line all the way up into Tuktoyaktuk. And stemming from those conversations, this is part of a bigger conversation that's happening with them about how we can maximize the services in the telecommunications space in the Northwest Territories. So, Mr. Speaker, the conversations continue, and I'm more than happy to keep the member up to date. Thank you.
Thank you, Member. Minister of Finance. Oral questions. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, as I said in my member's statement, the NWT has does not have access to a medical communication system that's vital for diagnostic imaging, which requires healthcare professionals to put scans on discs and then send it down with patients on appointments on medical travel. Can the Minister speak to what her plan is to resolve this so we can bring our healthcare system into the modern era? Thank you.
Thank you, Member from Range Lake. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, we are currently seeking we are working on the procurement process for the new electronic medical records. As I've said in this House many times, our EMR is coming to an end. They will not be supported any longer. But what I will say is that it's, you know, the things that the member is raising, we are well aware of these issues, and that's why the urgency on this RFP going out to ensure that the procurement process rolls out. And then, depending on the system that they say thinks that meets the needs, will depend on how long that rollout takes. Thank you, Mr. Speaker.
Minister of Health and Social Services. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, it took years to implement the current EMR system across the Northwest Territories. My concern is that this RFP won't go far enough to correct the issues that nurses and doctors are experiencing. So can the minister reassure our healthcare workers that this RFP will address these concerns throughout the Northwest Territories? Thank you.
Member from Range Lake. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, I appreciate the members bringing this up, and as far back as I think it was 17 years ago as we started rolling out EMR, and then up until last year was the final community that received the rollout. Now the program is not able to be supported. So I agree with the member that the process, and I know that technology has changed. I know that our access to internet throughout the territories is much better than it was 17 years ago. So as I have more details as the procurement process and the rollout of that, I will provide, I will offer a briefing to the members if that's what they choose. Thank you, Mr. Speaker.
Minister of Health and Social Services. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, nurses and doctors have to deal with as many as 3 systems, not just one. I think only one of them is electronic. The other 2 are paper systems. So what is the minister's, will these changes phase out paper? Let's just leave it limited on Stanton, where a great deal of these issues are creating bottlenecks. Thank you.
From Range Lake, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, I'm not going to delve down into which programs. Yes, there are multiple systems, and that is the problem, is that none of them talk to each other. And so when physicians and any practitioner has to access blood work or the appointments or the charting tool, yes, they have to log into multiple different levels. They have to have, they can't get other staff to support them because of access to information and all of these different barriers, and those are all of the things that we're looking at. And there has been many, I think it says we've engaged over 400 individuals in the requirements that we're gathering to do this RFP, to be able to do the thing that the members and the staff that they need. Thank you, Mr. Speaker.
Minister of Health and Social Services. Vital supplementary. Member from Range Lake.
Thank you, Mr. Speaker, and I appreciate the minister's willingness to share information with this side of the House, and I'll take her up on that at the appropriate time when it's available. Mr. Speaker, the Diagnostic Imaging Partner site is in Calgary, so we send our requests to Calgary, they send it up to us, we put it on a disc, goes back to Edmonton. Can the minister look to find a new partner in Edmonton, because the systems in Calgary and Edmonton don't talk to each other either. So we have multiple systems in multiple jurisdictions that aren't talking to each other. So can the minister explore this, try to find a partner closer to where our patients go in Edmonton so we can stop this triangle of sadness? Thank you.
Member from Range Lake, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, I can commit to looking into what the process is and why we're using Calgary and not in Edmonton and all our patients are going to Edmonton. Yes, I'll commit to looking into that process. Thank you.
Minister of Health and Social Services. Oral questions. Member from Yonley Centre.
Thank you, Mr. Speaker. I have questions for the Minister of Health and Social Services. People are still calling the phone numbers provided and reaching grave disappointment. They're also even going down to the medical center to book appointment, but they're told, well, call back. So, Mr. Speaker, my question for the minister really is focusing around accessibility to doctors. What is stopping the department from creating an online doctor booking appointment platform that all Northerners can access in a timely way? Thank you.
Member from Yonley Centre. Minister of Health and Social Services.
Thank you, Mr. Speaker, and thank you to the member for that question, because that's the same question that I'd asked the department as to why could we do things during COVID and we can't do them now, and it's privacy. And there were exceptions made during the public health emergency that allowed for certain things that wouldn't meet the standards of our privacy. And so we are looking into those options right now as to what tool could be used. Thank you, Mr. Speaker.
Thank you, Minister of Health and Social Services. Member from Yonge Centre.
Thank you, Mr. Speaker. First of all, you can book at least one clinic here in Yellowknife. I looked up in Vancouver. I said, Vancouver, online booking of medical appointments, and all of a sudden my Google was flooded with options, Mr. Speaker. So maybe the minister can explain to the House, but not just to the House, to Northerners, what is the obstruction specifically that's stopping the government from making the system more user-friendly for the end user, which are the citizens, Mr. Speaker. Thank you.
Thank you, member from Yonge Centre. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, as part of this, the whole review of the EMR and accessing services and being able to book appointments, I think all of those are we're trying to tie those in all together through this review, and I understand that there may be pieces that we will be able to do sooner than later. You know, the patient portals that people have requested, you know, that's something that we want to be able to use, and you know, so I think that's one of the biggest parts of our whole system, is that it's very piecemeal together, and I acknowledge that, and that's the work that the department is doing right now. Thank you.
Thank you, Minister of Health and Social Services. Member from Yonge Centre.
Mr. Speaker, I think people would have a difficult time understanding why this is okay in the context of privacy and security during COVID, when we couldn't bridge to non-COVID times. So, Mr. Speaker, would the minister endeavour to see if we could change that, whatever the obstructing policy is, and I'd like to hear what it is, why it was okay during COVID, but not okay today. Thank you.
From Yonge Centre, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, what I will do is I will get the information so that I'm not saying the wrong thing on the floor, and get back to the members with an answer to that question. Thank you, Mr. Speaker.
Minister of Health and Social Services. Final supplementary. Member from Yonge Centre.
Thank you, Mr. Speaker. Upon that perfect answer I'm anticipating, is the minister prepared to bring forward some type of initiative to address this problem, because Northerners are tired of calling phone numbers that no one answers, and then when it does leave a message, no one phones them back, and they have to drive there to get appointments. Can you imagine how difficult it is for someone in the community? So is the minister willing to bring a timely initiative once we get an answer on this perplexing question, why we can't do things when we really should be able to? Thank you.
Member from Yonge Centre. Minister of Health and Social Services.
Thank you, Mr. Speaker, and thank you to the member. I just recently had an update that there is some workaround that's going on with the phone system. As I mentioned in this House many times, is the phone system that's in Stanton doesn't allow for what people would normally get to call and be put on queue for the next, it rings and then you have to wait for someone to answer and then leave a message if someone's on the phone. There is no other option. So what they're working on right now is a workaround, and as soon as I have more details if that workaround is going to work in our phone system, I will advise the members. This is something that is computer technology, again, that's going on in our system, and so, like I said, I'll let the members know as soon as I have the details.
Thank you, Minister of Health and Social Services. Oral questions. Member from Moultrie.
Thank you, Mr. Speaker. Mr. Speaker, can the minister explain how Municipal and Community Affairs is engaging community governments and Indigenous governments about shared responsibilities and what input they have had on the formula change? Thank you.
Thank you, Member from Moultrie. Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. As members are aware, the formula funding that has been reviewed previously and a few times has been out there for a while. Since September, August, September to now, MAC has been out engaging with communities through regional superintendents, also reaching out to communities to engage with them in regards to the new formula funding. So we made every effort, we're continuing to make effort to reach out to the communities to speak about the formula funding. In fact, just previously on Monday, I met with myself and the Department of MACA. We met with SAOs and community leadership throughout the territories through virtual. So the department is reaching out to all the communities, and it's been ongoing for a while. So thank you, Mr. Speaker.
Thank you, Minister of Municipal and Community Affairs. Member from Mophie.
Mr. Speaker, yes, thank you for the information. Mr. Speaker, I have an issue with this formula. I would like to know what studies were done to show the formula is adequately meeting the needs of small communities. Thank you.
Thank you, Member from Mophie. Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. The point behind this funding is not to run a community fully 100%. It is to operate the community's essential services, so your water and sewer, your public works department, you know, and to make sure that the funding is there for those key services. Every community has a right to operate their community the way they want. They can charge fees, they can charge you know, service fees or recreation fees, that kind of thing. So that the whole formula based on their operations is how MACA distributes the funds that we currently have for the communities. Thank you, Mr. Speaker.
Community Affairs. Member from Mophie.
Okay, well, it would be nice if they can show us the formula. Can the minister explain how the department knows or determines what amount of funding is adequate? Thank you.
Mophie. Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. I'm more than happy to, and actually I think we're sitting with a committee here soon to explain all this. But it is a pretty detailed formula based on communities' assets. So for an example, if we're calculating the O&M, we're taking the infrastructure, taking the safety and recreation of the community, the administration and the services, and we're calculating it all together to make the formula up. So there is a few steps to it. It's not just one simple step, and that's all based on what the community's needs are to provide those key services. Thank you, Mr. Speaker.
Thank you, Minister of Municipal and Community Affairs. Final supplementary. Member from Mophie.
Mr. Speaker, this is not good. Well, this is not good for a small community, especially, for example, Wukoti. It's not really comparable to Yellowknife. Wukoti relies more on funding because of the high cost of living. It's not just Wukoti, it's other communities. Even in the South 2 region, we've been getting emails about the high cost of living, and yet it appears they will be getting less. So can the minister explain whether there is a different funding formula being used to take into account community size, or is this offset somehow? Thank you.
Thank you, Member from Mophie. Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. So the formula, the funding provided for the formula, we all know has been not enough for communities, and it's been an ongoing issue, and it will continue to be an issue if it's not a priority. So right now, what we're doing is we're taking the roughly $110 million, we're dividing it, and our goal is to equitably divide it amongst the communities for their assets and their actual needs. And that, it's not ideal, obviously. It'd be nice to have 100% funding for all the communities, but the reality is we have to find a way that distributes this funding equitably and fairly across the territories to all 33 communities. Problem is in previous formulas, we've had some communities that have been overfunded, some over 100%. So essentially providing a lot of money to a community that doesn't necessarily need it. I mean, they all need it, but when you have a larger community or another community that can't operate because they're underfunded, there's a problem. And that at some point, this has to be fixed in order for new funds to come in instead of throwing money at a problem. Thank you, Mr. Speaker.
Thank you, Minister of Municipal and Community Affairs. Oral questions. Member from Mackenzie Delta.
Thank you, Mr. Speaker. Further to my member statement, last week the Minister of Housing stated that the wait list across the Northwest Territories is 897 applications. I was just wondering how much authority does the board level, the board at the local housing authority have? And my question is, what is being done to clear the wait list of nearly 900 applications for public housing programs? Thank you, Mr. Speaker.
Thank you. Member for Mackenzie Delta, Minister for Housing and NWT.
Thank you, Mr. Speaker. I understand the needs for housing in the Northwest Territories is difficult, and that 897 families on the wait list is almost an insurmountable task for the Northwest Territories and for this government. And the Legislative Assembly has made housing its #1 priority. Housing NWT is up to the task, along with this government, but that requires both federal funding, territorial funding, working with partners like our Indigenous governments, working with NGOs. So again, it's not insurmountable, but we have to make headway. We have been making some headway over the last couple of years, especially with the 19th Assembly, and we continue to do the work. Thank you, Mr. Speaker.
Thank you, Minister for Housing and NWT. Member for Mackenzie Delta.
Thank you, Mr. Speaker. In my riding, especially in my community, we see a lot of people that are approaching me and asking me, like, what is the government doing? Where are all these, where's the money to allocate housing? How many of those 897 applications include residents in the Mackenzie Delta communities? Thank you, Mr. Speaker.
You, member from Mackenzie Delta, Minister of Housing and NWT.
Thank you, Mr. Speaker. Unfortunately, I wouldn't have that exact data at this moment, but I can commit to the member to provide that to him for Mackenzie Delta riding. Thank you, Mr. Speaker.
Thank you, Minister of Housing and NWT. Member from Mackenzie Delta.
Thank you, Mr. Speaker. Thank you to the Minister for that response. I await the numbers. What is being done to get more public housing units available and accessible on the ground in the communities? Thank you, Mr. Speaker.
Member from Mackenzie Delta, Minister of Housing and NWT.
Thank you, Mr. Speaker. Over the last number of years, Housing NWT has provided reports, done community housing plans with communities, has provided assessment reports with various contractors, has held NWT housing forums, has met with Indigenous governments, signed collaborative agreements with Indigenous governments to work together. There's much work being done, but the funding is limited again. So this is both a federal issue, a territorial issue, and something that we have to work together in partnership to get things done. But the work continues. Housing NWT has come up with a 3-year notional plan that is willing to present to committee, and this would outline some of the ideas that Housing NWT has over the next number of years. Thank you, Mr. Speaker.
Thank you, Minister of Housing and NWT. Final supplementary, member from Mackenzie Delta.
Thank you, Mr. Speaker. How is Housing NWT addressing the issue of suitability of housing? Thank you, Mr. Speaker.
Thank you, member from Mackenzie Delta. Minister of Housing and NWT.
Thank you, Mr. Speaker. I was trying to quickly look for the waiting list numbers for the member while he was asking the question. In terms of suitability for housing, again, this is work that's being done with Housing NWT. Suitability of housing requires many of our units to be modernized and improved. And this is something that I mentioned in the capital plan update last week, the ministerial statement, that there's 364 units that were in the plan to be modernized and improved over the next couple of years. So this is an indication that Housing NWT is working, is planning, is looking at data. We also have a territorial housing needs assessment that's being worked on at this moment, and that's something, again, that this House will have the information available. So work is being done. It's just information takes a bit of time. Thank you, Mr. Speaker.
Thank you, member or Minister of Housing NWT. Oral questions. Member from Greatsley.
Thank you, Mr. Speaker. Mr. Speaker, would the Minister of Justice be willing to explore a formalized relationship with an external oversight agency of the NWT's RCMP, an arrangement such as the one between the Yukon and the Alberta Serious Incident Response Team? Thank you, Mr. Speaker.
Minister of Justice.
Thank you, Mr. Speaker. And the department has looked at this previously. It was a few years ago, maybe around 2015, I believe. So currently, there is an oversight body in the territory, the Civilian Review and Complaints Commission. They review investigations into RCMP conduct. As the member stated earlier, though, those investigations are conducted by other police bodies, whether it's the RCMP or perhaps a municipal police force. The Alberta Serious Incident Response Team is something different. It's not headed by a police force. There's a civilian essentially at the head of that, and they work with police forces as well as independent investigators to actually look into the RCMP. And this is only for very serious incidents, not every complaint that might be brought forward. So we have looked into this previously. The cost is quite a bit. There would be from the last discussions we had, the requirement was to have a couple investigators on staff, and then as well as a travel budget for them to travel around. So we're looking in the hundreds of thousands of dollars for the 0 or 1 or 2 cases a year, or 3 or 4 or 5 cases even a year that they might deal with. But the caseload and the cost, they don't really align. What we are doing is making investments in body-worn cameras, and those are beginning to roll out this month, starting, I believe, here in Yellowknife and rolling out across the NWT over the coming year. And so hopefully that will provide some comfort to individuals as well who want to ensure that the RCMP are held accountable. And of course, that's what we all want. Thank you.
Minister of Justice, member from Greatsley.
Thank you, Mr. Speaker. Mr. Speaker, the Minister has assured me that increasing safety of Indigenous women and girls is a priority for him and the Commanding Officer of G Division. Can the Minister speak to how all parties are moving forward with fulsomely addressing the concerns of the Yellowknife Women's Society report in a meaningful fashion? Thank you, Mr. Speaker.
Thank you, member from Greatsley. Minister of Justice.
Thank you, Mr. Speaker, and that it is a priority. In fact, as Minister of Justice, I establish the RCMP policing priorities. We go out for input from Indigenous governments and other stakeholders, and from that we craft a limited number of policing priorities. One of those is to provide policing services that are responsive to the needs of Indigenous women, girls, families, and children experiencing family, intimate partner violence, and sexualized violence in the NWT. There's only 4 priorities, and so that is one of the 4 priorities. So it is a priority for myself, and we've made it a priority for the RCMP as well. The RCMP have been active participants in meetings to address housing and homelessness, which have been occurring more frequently here in Yellowknife. They've offered to work with the service providers to improve their working relationship and better understand the needs of the clients. And that's in line with what we're doing as a government, trying to integrate our services and work more closely and more respectfully with the NGOs as well. The RCMP, they did have a follow-up meeting with the Yellowknife Women's Society. And so the work is ongoing and will continue to be ongoing. Thank you.
Minister of Justice, member from Greatsley.
Thank you, Mr. Speaker. Mr. Speaker, I'm specifically interested in the Women's Society's recommendation that asks for resourcing for street outreach here in Yellowknife to be a 24/7 team, alleviating pressures on the RCMP. Can the Minister commit for his department to seek funding pots for services across the GNWT, departments across the GNWT that might address this crucial need? Thank you, Mr. Speaker.
Thank you. Member from Greatsley, Minister of Justice.
Thank you, Mr. Speaker, and there's no doubt that the street outreach program has been successful. I've spoken with the RCMP about it, and there's definitely a noticeable decrease in the types of calls that they have to respond to because of that team, and so I'm very supportive of that. Right now, the program is undergoing a review by the City of Yellowknife, and so once we see the outcomes of that review, we'll have a better idea of what we actually need to do, what type of support they might need from the GNWT, and we can look at what types of funding that could be accessed at that point. Thank you.
Thank you, Minister of Justice. Final supplementary, member from Greats Lake.
Thanks, Mr. Speaker, and thank you to the Minister. He'll be happy to know that review is out, and I look forward to hearing more from him. There are a suite of recommendations in the Women's Society report that discuss a comprehensive review of policing in the NWT. In particular, there's a request for consideration of establishing a Northwest Territories Police Council with Indigenous co-governance. Can the Minister say as to whether or not he's discussing this recommendation with the Council of Leaders? Thank you, Mr. Speaker.
Thank you, member from Greats Lake. Minister of Justice.
Thank you, Mr. Speaker, and then the member's correct. The review is out. We're reviewing the review. So that's the work that's happening now. The Council of Leaders, this is not a topic that has been raised at the Council of Leaders. The agenda there are decided upon by consensus, or as close as we can get to consensus, and this has not come up yet. But the new commanding officer is scheduled to meet with the NWT Council of Leaders at the next meeting, so I look forward to seeing what comes of that. Thank you.
Thank you, Minister of Justice. Oral questions, member from Sawtooth.
Thank you, Mr. Speaker. I was very impressed to hear the statement made by the Minister of Executive and Indigenous Affairs on Healthcare System Sustainability Unit, the creation of that unit, which leads me to my my first question to the Minister of Health and Social Services. After, excuse me, after a review of federal funded positions hired in the SATU, is a medical travel coordinator position feasible? Thank you, Mr. Speaker.
From the Sawtooth, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, many of our programs that are federally funded are, they're allocated as to certain areas that are, priorities of the federal government. And so we have to try and fit the needs of the Northwest Territories into that. However, with the medical travel, what I can do is I can commit to ensuring that we review as part of our process under reviewing medical travel where our staff are located and where are they located, it best meets the needs of the territory and the residents. Thank you, Mr. Speaker.
Minister of Health and Social Services. Member from the Sawtooth.
Thank you, Mr. Speaker, and thanks to the Minister for that commitment there. I look forward to the results of that commitment on review. Currently, as mentioned in my statement, we have 24 funded vacancies. My next question there, Mr. Speaker, will the Minister support medical escort assistant to that position as well? Thank you, Mr. Speaker.
Thank you, member from the Sawtooth. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, I'm going to have to talk more with the member as to what role that would be, and the way I'm interpreting it is it would be somebody that we would hire on to travel with people as escorts. But there are many family members residents that would want their family to. So I guess we would have to review to see if that's what the member is asking for, but I can commit to having further discussions to understand what that would mean. Thank you, Mr. Speaker.
Minister of Health and Social Services. Member from the Sawtooth.
Thank you, Mr. Speaker. As I mentioned in my statement and earlier as well, there's 24 funded vacancies. Will the Minister work with the other departments to see if those positions within their respective department will be filled? If not, is there a possibility of transferring that PY funds in the creation of a Satu Regional Medical Travel Coordinator? Mussy?
Thank you, member from the Sawtooth. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, the vacant positions within other departments, as Health and Social Services is an enormous department. It is the largest department, and if I if I start eating up all of their vacant positions that they may be trying to recruit for or having trouble recruit for, I don't think my colleagues would be too happy with me. But what I can do is, like I mentioned to the member, is I can commit to looking at what the needs are of the people of Sahtu. I traveled with the member. I heard a lot of different scenarios with along the lines of medical travel. So that is one thing that I will continue to highlight during our review to ensure that support is in place throughout the territory where it's needed. Thank you, Mr. Speaker.
Thank you, Minister of Health and Social Services. Final supplementary, member from the Sahtu.
Thank you, Mr. Speaker. I just want to say thank you to the Minister for looking at filling those 2 positions, possibly 3. Mussy.
Colleagues, please use this oral questions, ask questions. Thank you. Oral questions. Member from Yellowknife North.
Thank you, Mr. Speaker. My questions are for the Premier around the Healthcare Sustainability Unit. So the first question is, does the Premier view the mandate of the Healthcare Sustainability Unit as primarily to cut services that are non-core, seen as perhaps unnecessary or too fancy? Thank you, Mr. Speaker.
Member from Yellowknife North, Mr. Premier.
Thank you, Mr. Speaker. No, I don't see the primary mandate of the Healthcare System Sustainability Unit to be the cutting of services. The Healthcare System Sustainability Unit is tasked with establishing a core services inventory for the insured and non-insured programs and services, and quantifying their financial impact and their operational needs. It's going to identify inefficiencies, duplications of resources, and unnecessary processes in healthcare operations, and recommend changes to enhance the overall efficiency. It's going to establish a continuous improvement cycle that includes a monitoring and evaluation framework that demonstrates how progress is being made and how it's being made in a sustainable way and how it will be measured. It will evaluate the current programs to identify sustainable service levels, and it will work with the department and health authorities to enhance service delivery and develop cost-effective healthcare solutions. So this unit has been created so we can actually get a handle on the healthcare system, know what we're doing, know how much it costs, and then figure out how to do it better and more efficient so that we can achieve this Assembly's priority of ensuring basic access to basic health care for all residents. Thank you, Mr. Speaker.
Yellowknife North.
Thank you, Mr. Speaker. And so there has been a lot of emphasis in the Premier's statements about the unit being focused on figuring out which health programs and services are core. So maybe the Premier could enlighten us as to some examples of services that the Premier would consider to be non-core. Thank you, Mr. Speaker.
Member from Yellowknife North, Mr. Premier.
Thank you, Mr. Speaker. So that's the work that this unit is going to do. I'll say the majority of what the health authorities do, the programs and services they deliver, they're necessary. They're not optional. You know, we're not going to send people who need dialysis all down south to the provinces to get their treatment. The types of services that residents need in the territory and that we can reasonably expect to deliver in the territory, we want to continue doing that. But the fact is that there's programming across the department or across the authorities that it could be duplicative, it could be inefficient, it could be a remnant of an old federal program that we no longer have the money for and doesn't align with our priorities. So we want to ensure that we get a good view of what's actually happening and making sure that it's efficient and making sure that we're monitoring that it's efficient. Thank you.
Mr. Premier. Member from Yellowknife North.
Thank you, Mr. Speaker. So can the Premier clarify whether the work of the Healthcare Sustainability Unit will include workforce planning? So that could include how many clinicians and which kinds of clinicians will need to deliver integrated care to all NWT residents. Thank you, Mr. Speaker.
Thank you, member from Yellowknife North. Mr. Premier.
Thank you, Mr. Speaker. So looking at the inventory of programs and services and how those programs and services are operating and what their operational needs are is part of that work. and the number of staff, number of physicians, clinicians you need to do your work falls squarely in that. So that is part of the work. Thank you.
Mr. Premier, final supplementary, member from Yellowknife North.
Thank you, Mr. Speaker. So finally, can the Premier commit to making the work of the unit public, including ongoing progress reports that we can expect here to be given to members? Thank you, Mr. Speaker.
Member from Yellowknife North. Mr. Premier.
Thank you, Mr. Speaker. So without knowing exactly what the unit is going to encounter in their investigations, because they're looking into all of the data that's been collected over the years, all of the reports that have been published. They're hearing from frontline staff, from others within the department and the authorities. I can't say that we'll make everything public, but I can definitely commit to providing regular updates to the members and to the public through this House and other forums over the course of this initiative, so that people can see what's happening and hold us accountable if what we're doing is not working. Thank you, Mr. Speaker.
Mr. Premier. Oral questions. Member from the Decho.
Thank you, Mr. Speaker. My questions are for the Minister of Health. Who is the authority making the decisions on medical escorts being approved? Thank you. Thank you.
So, member, are you asking for the Health and Social Services? Okay, thank you. Sorry, I thought I heard housing. My fault. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, non-medical escorts are recommended by the health practitioner and may be approved by the medical travel officer if their request for medical escorts meets the criteria in the respective policy. And so the Northwest Territories, Government of Northwest Territories, we have a policy that lays out what a non-medical escort for when people are traveling for insured services. And then there's also, this is where we can get complicated. And then if it doesn't meet the GNWT, there is an option to, if they're Indigenous, we could put a request through NIHB, but then that would go to NIHB and we would have to wait for an approval from them. Thank you, Mr. Speaker.
Mr. Health and Social Services. Member from Decho.
Thank you, Mr. Speaker. How many non-medical escort requests have been denied for elders requiring assistance in the last year?
Decho. Minister of Health and Social Services.
Thank you, Mr. Speaker. When I look at what non-medical escorts that have been denied, I don't have that data. I can find out if the department tracks that data as to breaking it down to who was denied or what the reason was denied, and when they say denied, they don't meet the criteria. So within the medical travel policy, some people may not meet the criteria, or the person who's recommending the non-medical escort may not put in detail and are aware of the policy, so that they need to ensure that they document what those reasons are so that the medical travel staff can do the proper approval. But what I will do is I will commit to the member on this information if we do have that information available. Thank you.
Glenn, you going to stop it? Colleagues, before I go back to the Decho, member from Decho, I'd like to recognize representatives from the Office of the Auditor General in the Assembly today, Andrew Hayes, Sean McElhaney, and Emily Ann Duvall. Welcome to our Assembly. Member from the Decho.
Thank you, Mr. Speaker. Can the minister commit to review the policy to ensure it is being followed properly? Thank you.
Thank you, member from the Decho. Minister of Health and Social Services.
Mr. Speaker, yes, the plan is for the review of the medical travel policy, and some of these areas that the members have raised are part of that, the review of the policy. Thank you.
So, final supplementary, member from the Decho.
I don't have any more questions, sorry. Thank you.
Questions? Member from Trinidad Willity.
Thank you, Mr. Speaker. Mr. Speaker, there is consensus in the Northwest Territories for Indigenous governments to govern themselves. And in the selection of the Premier of this year, we talked about it could happen within the next 50 years. Mr. Speaker, can the Premier update the Assembly on the progress made this year towards improving self-determination as we approach the end of this first year of this government? Thank you, Mr. Speaker.
Thank you, member from Trinidad Willity. Mr. Premier.
Thank you, Mr. Speaker. That's a big question. What progress has been made towards self-determination? It's not an easy path, as everyone is well aware, but this government, we've released a mandate that makes very clear that we intend to work with Indigenous governments as partners, not as vassals of the state. So we've done our best to implement that work. The Council of Leaders meetings have been, I think, more successful every time that we've met. We recently traveled to Ottawa with a number of Indigenous leaders to lobby on shared priorities. And I think that when you do that, you're empowering, for the GNWT's perspective, we are working with the Indigenous government so that their voice is also heard. They're helping determine the resources that are coming to the territory by going to Ottawa together with them. And just in case I misspoke, we didn't bring Indigenous governments to Ottawa. We went together as the Council of Leaders. So that's one area. Earlier today, we heard about the project finance for permanence that the government and a number of Indigenous governments have been working on together, and that's a way to advance self-determination. We are working together with Indigenous governments on implementing or creating an action plan to implement the United Nations Declaration on the Rights of Indigenous People, so that work is ongoing. So those are a few examples of the work that's happening. Thank you, Mr. Speaker.
Thank you, Mr. Premier. Member from Trinidad Willity.
Thank you, Mr. Speaker, and thank you, Premier. The 1992 Burke Report made it clear that the work towards self-determination and decentralization could be accomplished without constitutional reform. The Burke Report lays out much of the groundwork needed towards more equitable future for Indigenous government. My question to the Premier is, does the Premier agree on the relevancy of the recommendation of the Burke Report provides, and does he support revisiting and updating report's recommendation? Thank you, Mr. Speaker.
Thank you, member from Trinidad Willity. Mr. Premier.
Thank you, Mr. Speaker. So I've been furiously trying to find the Burke Report online. It's not that easy to find, so I don't have it at my fingertips right now. But from what I've heard in the territory, the path forward is settling land claims. That's what I'm hearing from the Indigenous governments. I am interested in looking at the report. Whenever I hear about constitutional reform, I think that would take all of our efforts and all of our focus would be on that, and we wouldn't be achieving other things that might be more closer in reach for us. So I'll leave it at that, and I'll have a look at the report. Thank you, Mr. Speaker.
Mr. Premier, member from Trinidad Willity.
Thank you, Mr. Speaker, and thank you, Premier. During the previous Assembly, a special committee on reconciliation and Indigenous affairs was struck to study the implementation of UNDRIP. My question to the Premier, will the Premier commit to striking a similar committee or comparable working group that can work alongside the Council of Leaders to maximize Indigenous and self-government in the Northwest Territories, and to ensure the working group establishes proper consultation engagement on the subject? Thank you, Mr. Speaker.
Thank you, member from Trinidad Willity. Mr. Premier.
Thank you, Mr. Speaker. So the United Nations Declaration on the Rights of Indigenous Peoples Implementation Act does require the government of the Northwest Territories to work with the Indigenous governments, and there is a working group actually struck right now that is working on developing that action plan. So that work with Indigenous governments is happening. I'm not sure if the member is speaking of a group of MLAs, but we're definitely working with the Indigenous governments. Thank you.
Thank you, Mr. Premier. Oral questions, member from Trinidad Willity.
Thank you. Thank you, Mr. Speaker, and thank you, Premier, for your response. Can the Premier commit to providing more transparency around the process of attaining greater self-government and decentralization of services, and provide regular timelines and updates on the work towards these goals. Thank you, Mr. Speaker.
Thank you, member from Trinidad-Willowdale. Mr. Premier.
Thank you, Mr. Speaker. I need a little more specificity in that request. That's a lot of reporting. We will have reporting through the UNDRIP Implementation Act plan. We have a member from Standing Committee on Accountability and Oversight attending the Council of Leaders meetings. We do share negotiation updates with the members, but if there's something that we can do, if the member has something specific in mind, I'm happy to work with them and see what else we can make public. Thank you.
Thank you, Mr. Premier. Oral questions. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, I just wanted to follow up a little bit further on the questions I asked earlier. I was wondering if the Minister of ECC would commit to a year for getting this process done. So having targeted amendments to the waters regs done by the October session of 2025. Thank you.
Thank you, member from Frame Lake. Minister of Environment and Climate Change.
Thank you, Mr. Speaker, and thank you to the member for the question. This is a collaborative exercise that we work very closely with the ICGS in how we move this forward. So the department, although we may have the wish to be as timely as possible, we need to consider all of the other participants in the process and ensure that we're communicating and we're collaborating to achieve the best results. Thank you, Mr. Speaker.
Minister of Environment and Climate Change. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, I appreciate that the minister doesn't want to preclude anything that happens at the IGC, but I just want to note that this is something that I've been raising since right at the beginning after we got elected, and we're already a year in. If we commit to 2025, we'll be 2 years in for a process that was supposed to be targeted and quick. So that's why I'm trying to push the minister to commit to something. Could the minister commit to working with the parties to set a date and come back to members with a timeline that they think is realistic? Thank you.
Thank you, member from Frame Lake. Minister of Environment and Climate Change.
Thank you, Mr. Speaker. Mr. Speaker, yes, I will certainly reach out to the department and ensure that we are having the appropriate conversations with our partners to determine the best path forward, and hopefully that will result in a timeline that I can return to the member in this House. Thank you, Mr. Speaker.
Minister of Health and Environment and Climate Change. Oral questions. Member from Yellowknife Centre.
Thank you, Mr. Speaker. Mr. Speaker, I was getting phone calls, text messages yesterday from people in the South Slave, more particularly in both in Hay River and Fort Smith, regarding the layoff notices given to the Fort Smith Correctional Center staff. And if I remember correctly, 32 employees work there. The Finance Minister did say during Committee of the Whole back in June that they were pausing it with an uncosted plan, unplanned, but they were going to propose something. Mr. Speaker, I emailed the Premier last night for an update. I'm going to ask the Finance Minister, could she explain the initiative, or sorry, the steps they're taking with respect to these layoff notices to these 32 people in Fort Smith? Thank you.
Thank you, member from Yellowknife Centre. Minister of Finance.
Thank you, Mr. Speaker. Mr. Speaker, I can say at this point staff are not being given layoff notices, but we are trying to take a much more proactive approach here. As such, there was an informal initial meeting held in October 25th with some senior members from the Department of Justice, Department of Finance, Human Resources, in order to start to communicate to staff so that when the time it does come that the funding here is for 1 year, and so if the time is coming up, rather than waiting until formal notices are provided, that staff actually have information in advance, they can have choices, they can ask questions in advance, and that way, when the clock does start to tick on getting a formal notice, people have the opportunity to make choices well in advance and with lots of time ahead of them. Thank you.
Thank you, Minister of Finance. Member from Yellowknife Centre.
Mr. Speaker, my question really isn't being answered in the sense of, was this just a friendly conversation that we don't know what we're doing, or what type of notice was specifically given to these 32 employees who I'm hearing are concerned that they were giving specific job action notice. In other words, your job's ending and here's your notice. Maybe the minister could be very clear on the record to explain what exactly was told to the employees with respect to the employment. Thank you.
Thank you, Member from Milne Centre. Minister of Finance.
Thank you, Mr. Speaker. Mr. Speaker, I wasn't present at the meeting, so I'm not going to try to quote anyone that was present. Mr. Speaker, whenever there's a situation where individuals or staff are facing a change in their status, we have what are called the Staff Retention Policy Guidelines. We have staff retention policy, and we always make every effort to ensure that any employee who's facing a change in their status of employment has that full benefit. What happens is that under the staff retention policy, a staff member would get a 21-week notice period. That clock starts to run when someone gets their notice. They were not given their notice. Rather than waiting until someone gets their notice, senior members went and met with individuals ahead of the time when that notice would have to be given, so that when they get their notice, they are actually able to make choices about what types of route they may want to take in order to enact under the staff retention policy. Some individuals are eligible for retirement, some individuals may be interested in a transfer, but again, waiting until that clock starts to tick when you get your notice is not the way we're going here. We want to empower our staff and make sure they have all their options available to them. Thank you.
Minister of Finance. Member from Milne Centre.
Mr. Speaker, so in other words, is the government planning to lay these employees off, noting that the official paperwork of layoff notices isn't given, but this 21-week articulation of be aware of, well, just be aware, and we don't know yet. So I need to understand, was it just a shot over their bow to say, we're not laying you off today, but we don't have a plan, which means there may not be a job for you? Thank you.
Thank you, Member from Milne Centre. Minister of Finance.
Okay.
Thank you, Mr. Speaker. I think the Finance Minister has answered the question twice now, so the member can check answered once this is over. Thank you.
Final supplementary, member from Milne Centre.
Mr. Speaker, I think I'm having a difficult time, and I'm sure this will be a personal joke back or a shot or whatever, but I'm having a difficult time understanding this little dance between what a real layoff notice is. Can you imagine the employees, the 32 employees there, hearing this message? 21 weeks is 147 days. It's 153 days. In other words, 6 days difference between the end of March 31. So those who follow the math quickly it's almost 21 weeks till the end of the budget year. Mr. Speaker, my question specifically to the minister is, can she make it absolutely crystal clear what the plan is in that facility? Because we left here in June that they would find a plan and support for those employees. Thank you.
Thank you. For Milne Centre. Mr. Premier.
Thank you, Mr. Speaker. Instead of just receiving a notice in the mail, staff went there to personally speak with employees, let them know what the options are going forward, because there is no more funding for that facility at the end of this fiscal year. Thank you.
Thank you, Mr. Premier. Colleagues, our time is up for oral questions. Recognizing the time, we've been here for a while. We're going to take a break so our translators can rest and take a break as well. Thank you. return to a question? Replies to the Commissioner's address or replies to the Commissioner's address? Petitions. Petitions. Tabling of documents. Minister of Education, Culture and Employment.
Mr. Speaker, I wish to table the following document, operating plans for the Northwest Territories education bodies for the 2024-2025 school year ending June 30th, 2025. Thank you, Mr. Speaker.
Thank you, Minister of Education, Culture and Employment. Table of documents, Minister of Finance.
Mr. Speaker, I wish to table the following two documents. The 70th Annual Report of the Northwest Territories Liquor and Cannabis Commission 2023-2024 and the 70th Annual Report of the Northwest Territories Liquor Licensing Board Enforcement 2023-2024. Thank you, Mr. Speaker.
Minister of Finance. Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. I wish to table the following document. The Northwest Territories 911 Service Annual Report 2023-2024. Thank you, Mr. Speaker.
Thank you. Tabling of documents. Colleagues, I wish to table the report of the Auditor General of Canada of the Northwest Territories Legislative Assembly on the Staten Territorial Hospital Renewal Project. Tabling of documents. Tabling of documents. Colleagues, now we'll take a break. Thank you very much. Notice of motions. Member from Yonge Centre.
Thank you, Mr. Speaker. I give notice that on Thursday, October 31st, 2024, I will move the following motion. Now, therefore, I move, seconded by the Honourable Member for Cam Lake, that the Legislative Assembly recommends the reappointment of Ms. Nicole McNeil of Yellowknife as Executive Director of the Human Rights Commission during good behaviour for a term of 4 years as recommended by the Board of Management. And furthermore, that the Speaker be authorized to communicate the effective date of the appointment to the Commissioner. And Mr. Speaker, at the appropriate time, I will be seeking unanimous consent to deal with this motion in the House today. Thank you, Mr. Speaker.
Thank you, Member from Yonge Centre. Notice of motion. Member from Rangeley.
Mr. Speaker, I give notice that on Thursday, October 31st, 2024, I will move the following motion. Now, therefore, I move, seconded by the Honourable Member for Nunavut Lake, that the House call on the Auditor General of Canada to conduct a performance audit of all aspects of the management of the Northwest Territories Health and Social Services Authority in its delivery of healthcare services, including medical travel and the recruitment and retention of nurses, doctors, and allied health professionals, and to prioritize this investigation. And furthermore, that the Speaker formally transmit this motion and the contents of our proceedings in relation to this motion to the Office of the Auditor General of Canada for their consideration. And Mr. Speaker, that's fine. Thank you, Mr. Speaker.
Thank you. Notice of motions. Notice of motions. Motions. Member from Yonge Centre.
Thank you, Mr. Speaker. I seek unanimous consent to deal with the motion I gave notice earlier today. Thank you.
Yonge Centre. The member is seeking unanimous consent to consider the motion for which notice was given earlier today. Are there any nays? Seeing no nays, the member from Yonge Centre, you may proceed.
Thank you, Mr. Speaker. Whereas Section 23 brackets 1 of the Human Rights Act provides that the Commissioner, on the recommendation of the Legislative Assembly, shall appoint an Executive Director of Human Rights Commission to carry out the responsibilities set out in the Human Rights Act. And whereas the Board of Management is tasked with recommending an individual to the Legislative Assembly, and the Legislative Assembly is prepared to make a recommendation to the Commissioner, and whereas the term of the current Executive Director of the Human Rights Commission is set to expire. Now, therefore, I move by the Honourable Member for Cam Lake that the Legislative Assembly recommends the reappointment of Ms. Nicole McNeil of Yellowknife as Executive Director of the Human Rights Commission during good behaviour for a term of 4 years as recommended by the Board of Management, and furthermore, that the Speaker be authorized to communicate the effective dates of the appointment to the Commissioner. Thank you, Mr. Speaker.
Thank you, member from Yonge Centre. Motion in order. To the motion. Question has been called. All those in favour? Yay. Opposed? Abstention? Motion is carried. Motions. Motions. Notice of motions. First reading the bills. Minister of Environment and Climate Change.
Mr. Speaker, I give notice that on Thursday, October 31st, 2024, I will present Bill 15, Northwest Territories Indigenous-Led Conservation Fund Establishment Act, to be read for the first time. Thank you, Mr. Speaker.
Thank you, Minister of Environment and Climate Change. Notice of motions for first reading of bills. Notice of motions, first reading of bills. First reading of bills. Minister of Justice.
Thank you, Mr. Speaker. Mr. Speaker, I wish to present to the House Bill 12, Business Day Statute Law Amendment Act, to be read for the first time. Thank you, Mr. Speaker.
Thank you, Minister. Pursuant to Rule 823, Bill 12 was deemed as a first reading and is ready for second reading. Mr. Premier. for Minister of Justice. All right. Right on. First reading of bills. First reading of bills. Second reading of bills. Okay, we'll go back to Mr. Premier.
Thank you, Mr. Speaker. Mr. Speaker, I wish to present to the House Bill 11, an act to amend the Motor Vehicles Act, to be read for the first time. Thank you.
Mr. Premier, pursuant to Rule 8.2 brackets 3, Bill 11 is deemed to have first reading and is ready for second reading. First reading of bills, first reading of bills. Second reading of bills, second reading of bills. Second reading of bills, consideration in Committee of the Whole, bills and other matters, table documents 193-20 brackets 1, with member from Trinidad-Wellady in the chair. Before we do that, colleagues, by authority given to me by the Speaker under Rule 2.2 brackets 4, I hereby authorize the House to sit beyond daily hours of adjournment to consider business of the House.
I now call the Committee of the Whole to order. What is wish of the committee? And we'll go to the member from Nunavut Lake.
Thank you, Mr. Chair. Mr. Chair, the committee wishes to consider table document 193-20 brackets 1, 2025-2026 capital estimates, Legislative Assembly, Health and Social Services, and Northwest Territories Housing Corporation. Thank you.
Thank you. Does the committee agree? Thank you. We'll proceed. Consideration in the Committee of the Whole of bills and other matters, table documents 193-20 brackets 1. Capital estimates 2025-2026. Legislative Assembly, October 29, 2024. Committee, we have agreed to consider table documents 193-20 brackets 1, capital estimates 2025-2026. Legislative Assembly. Does the Speaker wish to bring in witness into the chamber? Does the committee agree? Thank you. Sergeant at Arms, please escort the witness into the chamber. Thank you. Would the Speaker please introduce the witnesses?
Thank you, Mr. Chair. On my right is Kim Wickens, Deputy Clerk. On my left is Glenn Rutland, Clerk.
Thank you. The committee has agreed to forego general comments. Is the committee agreed to proceed to the detail contained in the table documents? Agreed. Thank you. Committee, the Legislative Assembly begins on page 16. We will defer the totals and review the estimates by activity summary, beginning on page 17, with the Office of the Clerk, with information items on page 18. Are there any questions? Seeing none, Legislative Assembly Office of the Clerk, Infrastructure Investment, $500,000. Does the committee agree? Thank you. Members, please return now to Legislative Assembly summary found on page 16. Legislative Assembly 2025-2026, capital estimates, $500,000. Does the committee agree? Thank you. Does the committee agree that the consideration of the Legislative Assembly is not complete? Does the committee agree? Thank you, committee, and thank you, Mr. Speaker and Sergeant Arms. Please escort the witnesses from the chambers. Committee, we have agreed to consider table documents 193-20(1), capital estimates 2025-2026, Department of Health and Social Services. Does the Minister of Health and Social Services wish to bring witnesses into the chamber? We'll go to the Minister.
Yes.
Does the committee agree? Thank you. Sergeant at Arms, please escort the witnesses into the chambers. Thank you. Would the Minister please introduce the witnesses?
Thank you, Mr. Chair. Joining me today from the Department of Health and Social Services are Chris Clark-McQueen, Director of Infrastructure Planning, and Perry Heath, Assistant Deputy Minister for Corporate Service and Cultural Safety.
Thank you. The committee has agreed to forego general comments. Is the committee agreed to proceed to detail contained in table documents? Thank you. Committee, the Department of Health and Social Services begins on page 38. We will defer the department totals and review the estimates by activity summary, beginning with administrative and support services on page 39. Information item on page 40. Are there any questions? Seeing none. Health and Social Services, administrative and support services, infrastructure investment, $500,000. Does committee agree? Thank you. Moving on to Health and Social Services programs, beginning on page 41, with information items on page 42. Are there any questions? Seeing none. Health and Social Services, health and social programs, infrastructure investment, $33,947,000. Does the committee agree? Okay. Sorry, I'm gonna go to the member from Yellowknife North.
Thank you, Mr. Chair. So I wanted to ask some questions about the Wellness and Recovery Center plans. So I know that the design work has already been completed and the project is close to breaking ground, but my hope would be that there could be some opportunities to tweak the design to ensure that it provides services more in line with what we need now in terms of the population it's intended to serve and the needs that they have. So I want to ask a few questions related to the operational aspects of the building that might have an impact on the capital side, because I think it's best raised before it's too late on this project. So the one thing I've heard over and over again is that we need a facility where people can stay for more than 12 hours at a time. And currently our system with having the different shelters, the day shelter, other shelter facilities in town, the sobering center, is that people are constantly having to get up and shuffle from place to place, and it doesn't provide somewhere with enough continuity where someone might actually be able to sit and take a breath and think about wellness and recovery and counseling and other opportunities to move forward with their lives. So in terms of design of this new wellness and recovery center, is the design adequate to provide somewhere where someone who does not have a home might be able to both stay there overnight and stay there during the day in order to provide that stability for them to make decisions to move forward with their life? Thank you, Mr. Chair.
Thank you. I'm going to go to the Minister.
Thank you, Mr. Speaker, or sorry, Mr. Chair. The Wellness and Recovery Center is, the process has already been awarded. It's already been started. The plan for this facility, which is 100% funded through the feds, was in order to replace the emergency shelter that we currently have in the day program, our day use center that's connected together downtown Yellowknife. The history of that building, I'm sure the member is very well aware of the problems that happened with and the struggles that happened within Yellowknife, is that this continuously was being bumped around and moved around because of the access to space. So this is a dedicated space now for this home, and I fully understand where the member is coming from, that you know, more robust services, but this facility in its whole is to provide overnight services and day use services for those members that that are currently accessing the services now. What the member, you know, and I'm not going to put words into their mouth, but when you start to expand on those services, those are other services that, you know, may not be the best place to be attached to this facility, but to be able to provide them with, you know, spaces elsewhere. So I'll leave it at that, Mr. Chair.
Thank you. I'm going to go to the member from Yellowknife North.
Thank you, Mr. Chair. So just to confirm, can the minister confirm that the answer is no, that there will not be opportunities in this new Wellness and Recovery Center for someone to both sleep there and stay there during the day to access wellness and recovery services? Mr. Chair.
Thank you. I'm going to go to the minister to the question.
Thank you, Mr. Chair. Mr. Chair, yes, there is an overnight space for, and there is currently an overnight space emergency shelter, and those users do use the day facility currently, and so they would continue to use that space. How the program evolves, you know, once we're in that space, and how we operate the program, and, you know, once we're in the space, you know, may change and may be able to provide other supports. But at this time, right now, where we are is we're just replacing what we currently have. And yes, they do stay overnight, and then they can, you know, be there during the day. Thank you.
Thank you. I'm going to the member from Yellowknife North.
Thank you, Mr. Speaker. So my understanding from the minister's response to previous questions is that there would be a capacity of 85 people during the day and an overnight capacity of 31 designated sleeping spaces. Is there any potential within the current design to have more designated sleeping spaces? If there's a capacity of 85 people during the day, to allow more of those people to be able to sleep there if they need to, because as we know, we are really struggling to find enough sleeping spaces for people in Yellowknife. Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Yes, I believe that there are actually more sleeping spaces in the new facility than we currently have. And there is a capacity under, you know, and I think built into it that can be expanded further. For more detail into that, I can turn it over to Mr. Heath, if that's okay with you, Mr. Chair?
Yes, please proceed.
Thank you, Mr. Chair. As mentioned, there is 31 designated spaces that are flexible, but the facility also has the ability to, in the common areas like the community hall and some of the open spaces, that it provides surge capacity if necessary. The complications around that, though, is the staffing model will have to change accordingly. So you can't say we have a hard 99 or 85 people there, because as you increase staff, then you would minimize the amount of people that are there. So we have to strike a balance around from an operational perspective, but we do have the ability to flex and use spaces for sleeping, provided we have appropriate staff to monitor. Thank you, Mr. Chair.
Thank you. I'm going to the member from Yellowknife North.
Okay, thank you for that clarification. Another thing I wanted to flag was the fact that with the current design, there is to be like a small empty parking lot next door, sandwiched between the Tree of Peace and this new Wellness and Recovery Center. And so it's currently an empty parking lot, and it's unlikely that someone will, take on that lot and choose to, build something new in that particular location. So I'm wondering if the department has considered acquiring this lot and using it as like an outdoor space that could benefit people using the Wellness and Recovery Center, and whether there's been any coordination or conversations with Tree of Peace in terms of a space that might be able to benefit both facilities and also help, provide safety downtown, and that if there is, safe outdoor spaces for people to be and hang out that is connected to the Wellness and Recovery Center and the Tree of Peace, that that could be sort of a really healthy addition to our downtown. Has that been considered in the design or development of this project? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. If I may turn it over to Mr. Heath. Thank you.
Thank you. I'm going to go to the ADM.
Thank you, Mr. Chair. So that parcel, we have considered it, and we actually reached out to the landowner and went as far as did a preliminary environmental assessment on that site. We were engaged in discussions with the City of Yellowknife around the proposed use for that site. Unfortunately, with the closing of the contract tender, we found ourselves in a situation where we may not have enough available budget in the project to acquire and develop that space in a manner that meets all the requirements of the City of Yellowknife. We are actively looking at that and hoping as we move through the project and we understand the project contingencies and how it moves forward, that there's still a possibility that we can form a partnership with the City of Yellowknife potentially and take advantage of that space. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Yellowknife North.
Thank you. That is actually great news to hear that this is being actively worked on and considered. I would urge the department to move forward with this, to continue to pursue this, and if it's a matter of taking a little bit of extra money, considering bringing this forward in a future capital budget, I can't imagine that a outdoor space with some seating or something would break the bank in terms of our capital budget. So I would encourage the department to continue to pursue that. I'm running out of time, so I'll leave it there. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Yellowknife Centre.
Thank you, Mr. Chairman. Mr. Chairman, I was just reading some notes there. I just wanted to follow up on a particular area my colleague had just raised a moment ago under the Wellness and Recovery Center area. Oddly enough, I'm not going to speak specifically to the wellness recovery, but sort of how we're going to deal with the broader picture. And she mentioned about sort of space and whatnot for people to stay, whether it's stay overnight or sleep during the day. And we have a perfectly good territorial treatment center, which is, hate to say it, 2 blocks over. And is there any consideration about how we're going to deal with the population, and could that provide a solution? The government's been heating that building for 2 years, and it was a place for young people to stay with challenges. Let me not understate that, but we don't need to go into the details of what type of challenges. But it, has a large kitchen facility, support area. It even has classrooms that we can offer supportive programming for people in this kind of nature who might need supportive services. Because I'm not sure this build one center to solve them all will work. The size is concerning with me, but I said I wasn't going to speak to it specifically. But I do view that it's going to attract a larger population than we're anticipating. So is there any way to see about sort of linking the two? Thank you.
Thank you. I want to go to the minister.
Thank you. At this time, that is not in the budget and in the capital plan. But I think where the project on the Wellness and Recovery Center, is 100% funded and was based. The proposal to the federal government was based on replacing and providing a fixed home for the services that are going into there. As for the other building, I can turn that over to ADM, Mr. Heath, if that's okay.
Thank you. I'll go to the ADM.
Thank you, Mr. Chair. Actually, the department is working collaboratively with the NTHSSA and the Department of Infrastructure in finding a way to bring that facility back online for a program use that was similar to its original intent. We have a lot to work to do on that, and there's some technical complications around that facility that we're working through, but we're planning for future use in the facility. Thank you, Mr. Chair.
Okay. Thank you. I want to go to the member from Yellowknife Center.
Thank you, and I thank both the Minister and the Deputy Minister for that. Is it possible, or Assistant Deputy Minister, sorry, although the last time I kept calling someone a higher title, they got the job, so maybe it's good luck. So the more specifically, Mr. Chairman, can the Assistant Deputy Minister or the Minister enlighten me as to two parts? The first part being the specific dates on when the Wellness and Recovery Center will open, but furthermore, what purpose are they working towards initiating a revised service at the TTC? In other words, is it compatible? Does it work together? Does it work in tandem? What's their objectives now that it's been raised that this is something they're working on? Thank you.
Thank you. I'm going to go to the Minister.
Thank you, Mr. Chair. Mr. Chair, the first part of the question is the occupancy date for the Wellness and Recovery Center would be late 2026. And then for the TTC building, as the member has referred to, I will pass that over to the ADM to respond to that. Thank you, Mr. Chair.
Thank you. I want to go to the member from Yellowknife North Center.
Oh, sorry. I thought the ADM was going to answer.
Oh, sorry. My apologies.
Thank you, Mr. Chair. As I mentioned in my previous comment, it is a program that was similar to there before I tied to the youth. There are some technical complications with that building I won't get into. It's not necessarily in this budget, but we're really working hard to keep the program in line with the original scope, which was linked to youth. Thank you, Mr. Chair.
Okay, thank you. I want to go to the member from Yellowknife Center.
Thank you, Mr. Chairman. I'll tell you what, I won't belabor this point on the TTC, but I would like maybe just one clarification, which is when can we anticipate some type of idea or plan proposal of this particular initiative? And that probably would be enough specific to the TTC. Thank you.
Thank you. I'll go to the Minister.
You can give that to the ADM. Thank you, Mr. Chair.
Thank you. Okay, I'll go to the ADM.
Thank you, Mr. Chair. Unfortunately, we don't have concrete timelines right now. We're working as diligently as we can. There's been tons of interest in this building from other NGOs and sectors around this, and we've recently, trying really hard to move it as fast as we can, but right now I can't commit the timelines, unfortunately. Thank you, Mr. Chair.
Thank you. I'll go to the member from Yellowknife Center.
Thank you, Mr. Chairman. I would appreciate any committee update you can provide on that. And I can appreciate that these are just plans, not initiated yet, but probably sort of bigger picture scoping of the issue at this particular time, and that's fine. Is there any way that they could provide a monthly cost as to what the current day shelter costs the government in its current form, in its current location? where the old visitor center is. Thank you.
Thank you. I'm going to go to the minister.
Thank you. I would have to get back to the member for that.
Okay, thank you. I'll go to the member from Yellowknife Centre.
Thank you. I'll accept that. If the minister could also elaborate on a manner of, say, staffing capacity, things like things along that, contractual obligations, whether it's janitorial, whether it's support services. So I'm just looking at an overall cost of, yes, it costs X dollars, but this is what it takes to run it. If we could get sort of that compendium of information, I'll just leave it as a block rather than trying to tie up 3 or 4 more minutes of trying to make sure I hit every I and cross every T. Thank you.
Thank you. I'll go to the minister.
Yes, thank you. At this time, the plan is to take the money from there where it currently is, which is the operations budget, that we can move that to the new. But I can commit to making sure we have the numbers as best as we can to the member.
Okay, thank you. Is there any further questions from the members? Okay, seeing none. Continue on. I'm going to continue with health and social services. Health and social services programs, infrastructure, investments, $33,947,000. Does the committee agree? Okay. Thank you. Moving on to the long-term and continuing care services, beginning on page 43, with information items on page 44. Are there any questions? Now we'll go to the member from Frame Lake.
Thank you, Mr. Chair. Mr. Chair, first kind of a preliminary question. What is our current total number of occupied long-term care beds in Hay River, Fort Simpson, and Fort Smith? And what is the current wait list in each of those communities? Thank you.
Thank you. I'll go to the minister.
Current long-term care beds we have are 204. And then we have number of residents residing in long-term care beds, 182, and people on the wait list, 35 currently.
Thank you. I'll go to the member from Frame Lake.
Thank you, Mr. Chair. I had asked about those 3 communities specifically, so if the minister could just break out that information in Hay River, Fort Simpson, and Fort Smith, please.
Thank you. I want to go to the minister.
Thank you. So long-term care beds in Hay River currently are 23. There's 23 beds used, and there are 6 people on the wait list. Which other community? Decho, 17 people in the beds and 2 people on the wait list. Fort Smith, there's 26 long-term care beds and 26 people occupying those beds and nobody on the wait list. Thank you.
Okay, thank you. I'll go to the member for Frame Lake.
Okay, thank you. So by my calculations, and I'm going to be speaking about a couple of different reports here. So we did long-term care review in 2015, which kind of initiated the process of planning for these facilities, updated that review in 2020, which found that the 2015 review had overestimated what the demand is going to be. And so based on these new numbers, the first year that they projected demand for was 2024. And I would just note, in Hay River, they estimated there was going to be a demand of 35. In Fort Simpson, they estimated there was going to be a demand of 25. In Fort Smith, they estimated there was going to be a demand of 33. So in every case in those 3 communities, the 2020 review, which was an update of the 2015, still overestimated what the demand was going to be. So considering that the projections have been shown in multiple cases of reanalysis, one of the reanalyses is by me, but I mean, I'm comparing numbers to numbers here. In both of these cases to have been, the estimates have been shown to be too high. Does the department feel it would be advisable to reassess these numbers and approach prior to moving forward with construction of new facilities? Thank you, Mr. Chair.
Thank you. I'll go to the Minister.
Thank you, Mr. Chair. Mr. Chair, we are currently working on the review of the bed projections. I think there was a commitment that this would be done every 5 years, and we are currently working on these the bed projections, and those numbers are also going to help guide us with the projects that are on here that are in the planning stages. So I'll leave it at that. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Frame Lake.
Thank you, Mr. Chair. So in particular, well, maybe I'll get into specifics on this one. So I note that can the minister give us an update as to where they're at with construction of the Hay River facility?
Thank you. I'm going to go to the Minister.
Thank you. I will pass that over to the Director, Mr. Clark McQueen.
The Director.
Thank you, Mr. Chair. Currently, we are in the design process, and we have committed to doing community engagement and have gone now twice to Hay River to do design workshop engagements to incorporate the various desires of the community, and we are anticipating that we will have the RFP for design services that went out in 2023 should be completed by October, or should be completed by September of 2025. And then after that, we will be going out for tender for the facility. There will be going into construction documentation phase, doing the drawings for the building, and then in 2025 going out for tender for construction of the facility.
Thank you. I'm going to go to the member from Frame Lake.
Okay, thank you, Mr. Chair. So in that process, is it going to be possible for reassessment of the planning for this facility in considering the assessment of the projections that the department is going to be undertaking? So I guess what I'm asking in plain words is, are we ensuring that the facility is right-sized for the demand prior to moving forward with construction?
Thank you. I'm going to go to the Minister.
Yes, thank you, Mr. Chair. Mr. Chair, a lot of these projections, when we look at what we have on the wait list, we use a lot of the data within that we have in our system. We initiated Interi, which is a system that will help also. And for more further detail, I can pass it on to the ADM, if that's okay with you.
Thank you. I'll go to the ADM.
Thank you, Mr. Chair. So the good news with planning is, and Hay River, is we have a design that's modular in nature. So we were lucky enough to work with the town of Hay River to get a site that's large enough that if we need to add additional beds in the future, we can. But right now we have a plan which is shown in the plan to build 24. We have a design that's incorporating the ability to expand and move forward. The good news is with the bed projections from 2025, all of our new facilities and all the planning will incorporate that knowledge of the bed projections going forward. And our model for building facilities is modular in nature. We can add 12 beds here and add extra 12 beds somewhere else if necessary. The other thing that's unique about, or not necessarily unique, but that's going on in Hay River, is there's an existing facility, Woodland Manor, that's reaching the end of its useful life, that at some point in the future we're going to have to make investment in. We're currently investing in critical pieces in that infrastructure to make sure it lasts. We get the most useful life out of it, so we can get the new facility up and running and operating. And then in the future, we'll have the ability in the new site, which just happens to be across the street from the health center, to add on and build more long-term care beds if and when the bed projections materialize. Thank you, Mr. Chair.
Thank you. I want to go to the member from Frame Lake.
Thank you. I appreciate that answer, and the modular construction certainly sounds like a good way to go ahead. So just to confirm, though, let's say the bed projections in 2025 come back and say demand is not going to be as high as what was originally projected. Are you going to be able to scale construction down to reflect that so that we have right-sized facilities?
Thank you. I'll go to the Minister.
Thank you. Thank you, Mr. Chair. Mr. Chair, that is part of the process of the planning. And within Hay River, like the members said, like the ADM said, is that we have the older facility. Those people will have to move into the new facility once it's decommissioned, as it's at the end of its life. So all of that information will to be taken into account.
Okay, thank you. Before I go to Frame Lake, the member from Lake, members, when you speak and when you're finished, can you just say thank you so that we could it's a technical thing so we can move on. So I'm going to go back to the member from Frame Lake.
Thank you, Mr. Chair, and thank you for that reminder. I guess finally, I really appreciate the Minister kind of clarifying that the planning process for the two other facilities that are referenced there in Simpson and Smith will have the opportunity to kind of benefit from the 2025 update. So I appreciate that. So the last question is, in the 2015 long-term care program review, the recommendations that it made spoke to funding to private facilities for construction of more units. I know that's something I saw in this that was something that was done in Hay River in the past, but is there a reason the department decided to go in a different direction from funding these existing facilities to expand and just decided to start operating its own facilities? Because the expansion option seems like a good one for communities where demand is growing more slowly than expected. Thank you.
Thank you. I'm going to go to the Minister.
Thank you. I will get the ADM to speak to stuff that happened in 2015. Thanks.
Thank you. I'll go to the ADM.
Thank you, Mr. Chair. In 2015, at the same time we were doing that work, we were also doing we did what you call a market assessment of interest for operators to take care and run private facilities in the NWT, and the message was really clear that our facilities weren't large enough, didn't have the scale to make it profitable for some large organizations from down south to come in and take care of facilities. It just didn't return value for money when we looked at it back in 2015. Thank you, Mr. Chair.
Thank you. Is there any other members that want to have questions? I want to go to the member from Yellowknife North.
Thank you, Mr. Chair. So just following up on my colleague from Frame Lake's questions about the long-term care facilities. Well, my first question is, if we are expecting in 2025 to do an update on bed projections, why would we move forward with planning for, in particular, the long-term care facility being proposed in Fort Smith and Fort Simpson, instead of waiting for the updated bed projections? Because the planning would proceed for a specific size of facility. It says the planning is for, in Fort Smith, a 24-bed facility, and yet we see now that there's actually nobody on the waiting list. So why would we move forward this year and spend $2 million on a planning study when the evidence we have now says that that's probably not the right size or the right direction to go, and we're already going to update the data next year anyway? Why would we move ahead and not, say, push it back a year until we've gotten those updated bed projections? Thank you, Mr. Chair.
Thank you. I'm going to go to the Minister.
Thank you, Mr. Chair. We'll turn that over to the ADM.
Thank you. I'll go to the ADM.
Thank you, Mr. Chair. Infrastructure projects, as you can imagine, take a long time to plan from beginning to the day that we open the doors. One of the key components of the planning study in a long-term care facility is indeed the needs assessment. The first piece that we have to clarify about the facility is how many beds are we going to build. So the projections are part and parcel of the planning study. Once we determine how many beds we need, we go to the operational plan, the functional program. Basically, we say how big the facility is, where can we locate it to, how it will integrate it with all the services and the programs that are in the community. The bed projections are exactly that. They are projections, but they are for multiple years, 10 years, 20 years out. The whole intention of doing the planning study and the whole intent is to have the needs assessment as a part of that, have it incorporated and part of the justification for the size and location and how the facility will be configured. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Yellowknife North.
Thank you, Mr. Chair. I guess where I'm getting caught up is that a needs assessment is one thing. A planning study for a specific 24-bed long-term care facility is a big step forward from an initial needs assessment. And so what I would rather see is a budget item come forward for, we're going to do a needs assessment this year, and it's going to include that data that we plan to get next year. But when we're asked for the next capital year to allocate $2 million to a planning study, that seems much bigger than a needs assessment. And it doesn't seem wise to package together the initial needs assessment with the planning study for the thing we've already decided we need. Is there any way to separate those two and budget this coming year for a needs assessment and not the planning study for the 24-bed facilities in Fort Simpson and Fort Smith? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. As you may see, the capital budget doesn't have amounts, and so a lot of these things will, they're on here because we need to do the things that the member is asking, whether or not it allocates this amount or how far we go. But the planning study to figure out how many bed facility that is going to be required for that is going to cost an amount. So we need to be able to allocate dollars to be able to do that work. So, it may not be what the member is saying, but there is an amount that will need to be able to, so we can spend to do that work. We can't take it off if we don't, we have to do the work. We have to do the planning study. Thank you.
Okay, thank you. I'll go to the member from Yellowknife North.
Thank you, Mr. Chair. So given that currently we have nobody on the waiting list in Fort Smith, and initially the estimated demand from the previous studies had been that there would be a demand of 33 people by now, it seems that that's pretty far off. And given that we're already moving forward more quickly with the long-term care facility in Hay River, where there's only 6 people on the waiting list, and the plan is to build a 24-bed facility. Is it feasible to think that perhaps people in Smith might be able to access a long-term care facility in Hay River if we were sort of overbuilding and building extra beds in Hay River that we didn't see an immediate demand for? Thank you, Mr. Chair.
And thank you. I'm going to go to the minister.
Thank you, Mr. Speaker. Mr. Speaker, I hear what the member is saying, but these are people's homes. This is their end of life. This is where they're going to rest. We don't want to move them. We want to keep them as close to home as we possibly can. As part of that plan, when the member says that there's nobody on the wait list, we currently have people and family members that are able to care for members, and they may be on the projections because they're heavy clients for home care and may require in the upcoming years. Age of our residents, within the next 10 to 15 years, we know that builds in this type of a process is not going to happen overnight. It's going to be over multiple years. These long-term care facilities have been discussed as far back as I think early into the 18th Assembly, where the bed projections have changed significantly, and that's why we do the work that we're doing as to making sure that we're doing the proper planning for these facilities. And at the end of the day, whether it comes back that there is a change in these needs, then we'll reassess the project. Thank you.
And thank you. I'll go to the member from Yellowknife North.
Nothing further this time, Mr. Chair. Thank you.
Thank you. Is there any other questions from members? There's one like that. Is the member from Frame Lake?
Thank you, Mr. Chair. Mr. Chair, this is a more general question just about long-term care in general, but are any of the long-term care facilities that are either planned or already built going to be able to provide a standard of care which would allow repatriation of out-of-territory long-term care patients? Because I know that's something that we spend. I looked back through the mains, and we're spending $45 million a year on out-of-territory long-term care, and so by building these long-term care facilities, is there a possibility for, what I'm really asking here is there any way that we're going to be achieving some cost savings? Because I know that the facilities will have their costs to operate, but are we actually building something that's going to allow us to bring people home? Thank you, Mr. Chair.
Okay, thank you. I want to go to the minister.
Thank you, Mr. Chair. Mr. Chair, the long-term care facilities, and I hear where the member is coming from. We do spend a lot of specialized out-of-territory based care for our residents in Northwest Territories. The thing with that, it's not space in the territory. We don't, but it's the specialty that they require of care. And long-term care, the levels of care that we provide in our long-term care facilities, depending on where. If you're in Inuvik, there's only a certain level of care that is able to be provided. And then we have different levels, like in the dementia center here in Yellowknife. That's a different level of care. But and a lot of the clients that are out of the territory require multiple different specialties that they require. And the staff that we're not saying we don't have the staff, but we don't have the staff capacity to be able to provide all of the needs to many of those clients. Saying that, we continuously reassess what services and how many people that we could potentially bring back to the territory, and what those might look like and what those numbers are. I couldn't answer that here today, because those clients, although they've been away for a long time, their needs change, and so we would have to reassess every client on a case by case to see whether or not our services in the territory could meet their needs. Thank you.
Thank you. I'm going to go to the member from Frame Lake.
Thank you, Mr. Chair. Appreciate it. And so I just wanted to wrap up my comments on the long-term care. I mean, there were some things that really stood out to me. I dug into this one a fair bit, looked at the 2015 report, and would just note that, a few of the things that were pointed out in the report is that if you increase the number of a service like long-term care, it can ultimately increase the demand for the service, interestingly, and that you can induce demand. And a point that I think is really important to note too is that, Northwest Territories has people who require long-term care at a much higher rate than other places in Canada and in Canada in general. And that tells me that we are not providing regular health care or keeping people healthy outside of long-term care and before long-term care at a level that we need to be in. So just noting that investing in long-term care is important. I don't deny that in any way, but I also want to note that we need to be focusing on providing basic health care to keeping people healthy, keeping people so that they don't end up in long-term care facilities should be our ultimate goal. So I think when I'm kind of looking at this system and looking at whether, we're right-sizing it, whether we're going to be spending money on that, I want to be clear that whatever savings that we can realize, I want us to be using that to keep people healthy, to provide basic health care, similar to what is being talked about in our healthcare sustainability unit, making sure that we're, right-sizing our system, making sure that we are getting adequate service into the communities, adequate service in Yellowknife too. I know I've got lots of constituents who are having a hard time accessing basic primary care. I'm one of them. So we've got lots of work to do. So just wanted to get those comments on the record that long-term care is important to me. I want us to be investing in it where we need to, but we've got to be careful to right-size this service because it's expensive to provide like everything else in health. And ultimately our goal should be keeping people out of long-term care so they can live healthy lives well into their 80s and 90s and be walking around the community and not in a long-term care facility. Thank you, Mr. Chair.
Thank you. I'm going to continue on now. go to the minister. Sorry.
Thank you, Mr. Chair. And I just, I want to thank the member for raising that. And what I wanted to highlight is that the 2015 report did not really, and I think this is the work that has changed, is that the focus has changed into providing preventative care to seniors, so more home support work, more home care, and providing that after-hour care. And for the care that happens outside of the clinic hours, that it's not just Monday to Friday, 8:30 to 5, and that's based on those projections that were from the 2015, is that we did not have these services outside of regular hours. And so when the change in the model and how we support residents to stay at home and remain in their communities longer by increasing those supports, that is exactly what the government has changed, and that's why the numbers kind of have decreased. So I just wanted to make sure that's why it's not comparing apples to apples with that report in the last projections that we did that changed so significantly. So just so that is the message out there. Thank you.
Thank you, Minister. I'm going to continue on. Health and Social Services, long-term and continuing care services, infrastructure investments, $27,485,000. Does the committee agree? Thank you, members. Please return now to the Department of Health and Social Services summary found on page 38. Health and Social Services, 2025-2026 capital estimates, $61,932,000. Does the committee agree? Thank you. I'll go to the member for Nuvik-Boot Lake.
Thank you, Mr. Chair. Mr. Chair, I move that this committee defer further consideration of the capital estimates for the Department of Health and Social Services at this time. Thank you, Mr. Chair.
Thank you. The motion's in order. To the motion. Question has been called. All those in favor? All those opposed? The motion is carried. Consideration of the Department of Health and Social Services 2025-2026 capital estimates. Total department is deferred. Thank you, committee, and thank you, Minister. Sergeant at Arms, please escort the witnesses from the chamber. Committee, we have agreed to consider tabled documents in 193-20(1), capital estimates 2025-2026, housing, Northwest Territories. Does the Minister responsible for housing, Northwest Territories, wish to bring witnesses into the chamber? Minister.
Yes, Mr. Chair.
Does the committee agree? Thank you. Sergeant at Arms, please escort the witness into the chambers. Thank you. Would the Minister please introduce your witnesses?
Thank you, Mr. Chair. Mr. Chair, with me today on my left is President of Housing NWT, Eleanor Young, and to my right is the Vice President of Finance and Infrastructure, Jim Martin. Thank you, Mr. Chair.
Okay. Thank you. Committee, Housing Northwest Territories is included in the capital estimates as an information item, and the total is not votable. We will continue to review these estimates as we have for the previous considered departments. However, we will not vote on the totals. If members have comments or questions, they can be raised at the appropriate time. The committee has agreed to forego general comments. Is the committee agreed to proceed to the detail contained in table documents? Committee? Agreed. Thank you. The committee Housing Northwest Territory begins on page 72. We will defer the total and review the estimates by activity summary, beginning at page 73 with finance and infrastructure services, with information items on page 74. Are there any questions from committee? Thank you. I'm going to go to the member from Great Slave.
Thank you, Mr. Chair. There is one item on the list, the project listing on page 74, biomass projects, public housing, and it lists the location as territorial. Could the minister please give more detail about what locations the biomass projects are projected to go to in public housing? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Mr. Chair, Vice President, Finance and Infrastructure will reply to the question. Thank you, Mr. Chair.
Thank you. I'll go to the Vice President of Finance.
Thank you. Thank you, Mr. Chair. Sorry, am I on? No. Do we have a question? Okay, it's on? Okay. Thank you, Mr. Chair. Yes, we have funds set aside for 25-26 to continue to advance our biomass system investments. We continue to advance these investments under our energy management strategy actions, and for 25-26, we've identified this allocation as various, given the fact that we are currently in the process of completing a biomass feasibility study across the territory, and we're going to wait for those results to determine the most appropriate, effective location for those biomass and for our next round of biomass investments. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Great Slave.
Thank you, Mr. Chair. So thanks for that. Do we know when that feasibility study will be completed? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Vice President, Finance and Infrastructure will reply to the question. Thank you.
Okay, thank you. I'll go to the Vice President of Finance.
Thank you, Mr. Chair. We're expecting to complete that study by the end of this fiscal year. Thank you.
Okay, thank you. I'm going to go to the member from Great Slave.
Thank you, Mr. Chair. I have one more question of the project listing. On all of the major retrofit listings, they are identified as public housing units, save one, which is 1 unit of market housing in Fort Liard. Can the minister please speak to why that 1 unit is market housing? Thank you.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. President Eleanor Young will describe the Fort Liard market housing retrofit. Thank you.
Thank you. I'll go to the president.
Thank you, Mr. Chair. Housing NWT, in addition to roughly 2,600 public housing units, has approximately 180 market housing units that it currently operates. And so much like public housing, as those units need retrofits or repairs, they are built into our capital planning. And so that's why you see a market unit on the list. Thank you, Mr. Chair.
Thank you. I'm going to go to the member from Great Slave.
Thanks, Mr. Chair. Nothing else at this time.
Thank you. I'll go to any other members that want to speak. I'm going to go to the member from Deschaux.
Thank you, Mr. Chair. You have here 14 public housing major retrofits in Fort Providence. When you say major retrofits, can you explain that?
Thank you. I'll go to the minister.
Thank you, Mr. Chair. Vice President, Finance and Infrastructure will describe major retrofit.
Okay, I'll go to the Finance, Vice President of Finance.
Okay, thank you, Mr. Chair. We refer to a major retrofit as essentially a major renovation of a housing unit. And it's reflected in this plan due to the fact that we consider it to be a major repair, and it's of a capital nature. So it would be essentially a major repair to extend the life of the current housing asset. Thank you, Mr. Chair.
Thank you. I'll go to the member from Decho.
So it's on a unit. Is it like something like a putting in a new furnace, or is it rebuilding part of the unit? Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. A major retrofit for a housing unit would include electrical, plumbing, foundation work, roofing work. It's detailed work to extend the life of the housing unit, but I will ask Vice President of Finance and Infrastructure to give more of a detailed description of a major retrofit. Thank you.
Yeah, thank you. I'll go to the Finance, Vice President of Finance.
Okay, thank you, Mr. Chair. For this specific retrofit, we're looking to undertake plumbing, sewer upgrades, and some repairs to the landings as well for health and safety as part of that work. Thank you, Mr. Chair.
Okay, thank you. I'll go to the member from Decho.
That's good.
I'm going to go to the member from Montfrey.
Thank you, Mr. Chair. Okay, I just wanted to ask, because we know that we're in a housing crisis. It's all over the north. It's not just my region, but it's within all the regions. And I see here for retrofit in Bichico, you know, like we have 130 people that are on the wait list, or maybe it's probably more than that, you know, and there's some families, they've been waiting for the last 2-3 years, and, you know, and they haven't moved up the list. So I'm just wondering why only 3 units that's being retrofit within this fiscal year when there are still other like 5 or 6 units that are boarded up. What is the department going to be doing with those boarded up units? Are they going to retrofit those units, or are they going to give it away to the community members? Because it's an eyesore, you know, like those boarded up units, it is an eyesore. It's not good, and people have been inquiring a lot about those units, and it's still sitting there. Thank you.
Okay. Before I go to the minister, just for clarification, are you speaking for your riding in terms of boarded up units?
What's that?
Speaking for your riding for the boarded up units?
Yes, I am asking because there's only 3 units that's within this fiscal year. I'm sure it's a major retrofit. You know, it's not replacing an appliance or anything like that. But I'm just asking why only 3 units that's being retrofitted, major retrofit, and there's still a lot of other units that are boarded up. What is the department going to do with those boarded up units? Because it is an eyesore. Thank you.
Okay. Thank you. I want to go to the minister.
Thank you, Mr. Chair. I was just getting some information from the Vice President. Currently, Bichico, there is 2 units being repaired and 15 units still to be repaired. The plan is that we repair 3 in Bichico, which would leave 12 units to be repaired once this capital budget is approved. The reason we're not repairing more units is this budget is based on what we have as Housing NWT for capital planning purposes. we look at our budget, we look at, we provide an analysis of our operating costs, and at the end of the day, we're left with $11 million for capital planning. So that's what's left over after everything is said and done for housing NWT. So the need is great throughout the territory, but this is the funds that we have left. Thank you, Mr. Chair.
Thank you. I'm going to the member from Montfrey.
Okay, thank you. I know the need is great throughout the Northwest Territories, and there's 12 units that you just mentioned. But I'm just wondering if the minister can answer me. Does the department really have any money to do work on these units, or is it just to get people's hope up that, okay, there's actually 3 units that's going to be retrofitted, and hopefully the waiting list will go down? Because from what I heard from the in Bichico is that they're asking people to move out of the unit because they're going to fix up the units. They're going to do a retrofit, when in fact they don't have any money. They don't have the funds to fix up those units. So I'm just wondering if the department, I'm not too sure if the department has any money to really to do the actual work on these units. Thank you.
Okay. Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. I asked the Vice President of Finance and Infrastructure, and he confirmed that housing has the funds to retrofit these units for the 25-26 fiscal year. Thank you, Mr. Chair.
Okay. Thank you. I'm going to go to the member from Montfrey.
Yes. Within this fiscal year or any other fiscal year, because there was a plan done for 10-year housing plan from 2012 to 2022 of how many houses they were going to retrofit. So that one is over and done with. So I'm just wondering, does the department actually have any funds to do major retrofit when they are, because the housing is saying they don't have any money to fix up some of these units. And other organizations have fixed up a unit because they didn't have any. The Indigenous government fixed up some of the units in my riding because housing do not have any, they don't have the funds to fix up those units. And asking people to move out when some of them are in good condition. Now they're sitting empty. I would like to see some of the people that are on the wait list to move into those units right now at the moment before it frees up, so it doesn't damage further. And then that's how a lot of these units are boarded up, thinking they're going to do something, they're going to fix it up. To date, there's a lot of them. There's about almost 10 units that are boarded up in Bichico that belongs to the housing. So I just want to know, I'm just asking if there's actually any funds allocated, and when are some of these constructions going to start? Thank you.
Okay. Thank you. I'll go to the minister.
Yes, Mr. Chair. There is funds. It's outlined in the capital plan. There's 2 houses currently being retrofitted and 3 planned for next fiscal year. So just to confirm, 3 for the 25-26 fiscal year. Thank you, Mr. Chair.
Okay. Thank you. I'm going to go to the member from Montfrey.
Well, 2 houses are being retrofitted. Is it currently being retrofitted? Because I know one house was already retrofitted, and that was not done by the housing. It was done by the Indigenous government that retrofitted that house because they really needed a client to move in there that was a forest fire victim. Thank you.
Okay. Thank you. I'm going to go to the minister, please.
Thank you, Mr. Chair. Housing NWT works with the Clecho government for housing retrofits and construction in the Clecho region. Thank you, Mr. Chair.
Okay, thank you. I'm going to the member from Montfrey.
Okay, I'm not sure if there was an agreement made between housing, and so I just want to know if Housing NWT are going to refund the Indigenous government for retrofitting one of their units. Are they going to refund, pay back? Because that is our Indigenous government money. That is our future generations. So I just want to know if the Housing NWT will be refunding the Indigenous government for retrofitting one of their units. Thank you.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. If there was a contract with Housing NWT to retrofit the unit, Housing NWT will pay the contract. Thank you, Mr. Chair.
Okay, thank you. I'm going to the member from Montfrey.
Well, that's good to know because she said it, so it's for the record. So I hope there is, I'm sure there is a contract, there is something in place somewhere. So I'm glad that, she mentioned it. So, yeah, no, I mean, Wati, they're in housing crisis as well, and I don't see them on the list here. Gamity, and I know Wikwiti only have few units that belongs to the public housing units. So why they are not on the budget this fiscal year or upcoming fiscal year? Thank you.
Thank you. I'll go to the minister.
Compared to others, we have to prioritize these.
Thank you, Mr. Chair. Again, I noted that Housing NWT only has so much funds, so we have to prioritize the retrofits across the Northwest Territories, and this list is the priority list at this time. Thank you, Mr. Chair.
Okay, thank you. Next on my list is the member from Mackenzie Delta.
Thank you, Mr. Chair. My question is, you have a lot of major retrofits in a lot of the communities. How old are these, the majority of these units that are being renovated? Thank you, Mr. Chair.
Thank you. I'll go to the minister.
Thank you, Mr. Chair. I would have to get a breakdown or an Excel spreadsheet to provide that information of how old the units are. But we have over 350 units that are 50 years plus, and we have about 1,100 public housing units that are 30 years plus. So a majority of our units are 30 years and older. It just gives you some insight to the age of our housing stock. Thank you, Mr. Chair.
Thank you. I'll go to the member from Mackenzie Delta.
Thank you, Mr. Chair. In Fort McPherson, you have nine units, and one were in McPherson this spring. You took a tour of one of the units that are over 50 years old, and there are more units in that category. Do you know if these are the similar ones that are being renovated in Fort McPherson? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. MLA Nursu is describing the older three-bedroom units that came into housing in the early 1970s, and they provided a tour of one of the renovated housing units. I'm not sure myself if these 9 units are the units that are in question, so I will ask Vice President Jim Martin to provide some insight to that. Thank you, Mr. Chair.
Thank you. I'll go to the Vice President of Finance.
Thank you, Mr. Chair. The 9 units planned for retrofit, they do deal with older units. Housing NWT typically plans for retrofits at midlife of the units, so that it'd be at least a 25-year mark and more. So in this case here, there's certainly 25 years and older. Thank you, Mr. Chair.
Thank you. I'll go to the member from Mackenzie Delta.
Yeah, just a final comment that these units that are around 50 years old that, you know, should be demolished or something, you know, they're just using a Band-Aid solution every few years to accommodate the community, and it's just not working. You need to find a better solution. It's just more of a comment. Thank you, Mr. Chair.
Thank you. I'm going to go to, okay, we'll go to the minister.
Thank you, Mr. Chair. Housing NWT realizes that much of its stock is aging stock. Again, the needs across the territory are great. There's been a number of reports, housing needs across the Northwest Territories, and hopefully with the territorial housing needs assessment that's going to be completed over the next 6 months, will provide better data both for housing, NWT, and this government. Thank you, Mr. Chair.
Thank you. Next on my list is the member from the Sawtoo.
Thank you, Mr. Chair. I see Delaney is on the list of repairs there with 6 units. I'm glad to see that. We've, on our recent trips, heard a number of concerns on the older stock having mold and mildew created as a result of these units. And I'm also glad to see that your tangible capital assets are equal, and it's the financing of these expenditures include funding from the CMHC and other various sources. That tells me that you're exhausting other people's money, which is good. How much of that, just a real general question, how much of that is coming from the federal government? Thank you, Mr. Chair.
Thank you. I'm going to go to the minister.
Thank you, Mr. Chair. For the 25-26 capital plan, Housing NWT is funding our projects internally. Thank you, Mr. Chair.
Thank you. I'll go to the member from the Sawtoo.
So maybe Mr. Chair, maybe the minister could explain what that statement is on page 72 about funding from CMHC. Thank you.
Thank you. I'll move to the minister.
Thank you, Mr. Chair. CMHC and CERNAC, we had a bilateral agreement signed with CERNAC in 2020, and those agreements provide us operations and maintenance dollars to maintain the public housing units across the Northwest Territories. It's approximately $19 million combined, $18 million combined, something in that range. It's declining year to year. We have the bilateral agreement that will decline or will end in 2028, and the CMHC agreement will end in 2038. Thank you, Mr. Chair.
Thank you. I'll go to the member from the Sawtoo.
I've got nothing further there, Mr. Chair. That answers my question. Thank you.
Thank you. I'm going to continue on if I don't see any members. See no further questions. I remind the committee that the estimates for housing Northwest Territories are included in the capital estimates as information items only. The committee will not be voting on the activity total. Please return now to the Housing Northwest Territories summary found on page 72. Are there any further questions or comments from committee? I want to go to the member from Inuvik-Boot Lake.
Thank you, Mr. Chair. Mr. Chair, I move that this committee defer further consideration on the capital estimates for Housing Northwest Territories at this time. Thank you, Mr. Chair.
Thank you. The motion is in order. To the motion. Question? Question has been called. All those in favor? All those opposed? The motion is carried. Consideration of the Housing Northwest Territories 2025-2026 capital estimates is deferred. Thank you, committee, and thank you, Minister. Sergeant Arms, please escort the witness from the chambers. Thank you. I'll go to the member from Nunavut Lake.
Thank you, Mr. Chair. Mr. Chair, I move that the chair rise and report progress.
Report progress. The motion is in order and not debatable. All those in favor? All those opposed? Motion is carried. I will now rise and report progress. Thank you.
Member from Tuna-Day Willowday.
Mr. Speaker, your committee has been considering table documents 193-20(1) and would like to report progress with 2 motions carried. And Mr. Speaker, I move that the report of the committee of the whole be concurred with. Thank you, Mr. Speaker.
Thank you. Can I have a seconder? Member from the Nutwood. To the motion. Question has been called. All in favor? Opposed? Oh, it's close. Close. Can I have that recorded or no? Abstentions. Motion passed. Oh. Me? Okay. Third reading the bills, third reading the bills. Order of the day, Mr. Clerk.
Thank you, Mr. Speaker. Orders of the day for Wednesday, October 30th, 2024 at 1:30 p.m. Prayer, minister statements, member statements, returns to oral questions, recognition of visitors in the gallery, acknowledgements, oral questions, returns to written questions, replies to the Commissioner's address, petitions, reports of committees on the review of bills, reports of standing and special committees, tabling of documents, notices of motion, motions, notice of motion for first reading of bills, First reading of bills, second reading of bills, Bill 11, Bill 12, consideration in committee of the whole of bills and other matters, table document 193-20(1), report of committee of the whole, third reading of bills, orders of the day. Thank you, Mr. Speaker.
Mr. Clerk, this House stands adjourned until Wednesday, October 30th, 2024 at 1:30 p.m.